All right, I think we have a good amount of folks in the building or virtually on our Zoom call. Thank you all for being here. My name is Nicole Arias. I am the Director of Equity and Engagement at the Office of Healthy Aging. So we'll begin shortly. I just want to make sure everyone here is able to take a moment and read some of our housekeeping rules. So welcome. Like I mentioned, there's no need to say hello. We're going to begin shortly. For those on this call, this session is going to be recorded and resources will be sent via email to participants at the end of this presentation. I have everyone's email and everyone that registered is going to have access to this pre-recorded meeting and as well as the resources that were shared by the presenters. Some housekeeping. So audio, please make sure that you're muted upon entry. Do not unmute your line. If you're joining via computer or phone or landline, just make sure that both are muted. I know some folks unfortunately lost power this morning. So I can imagine folks will be trickling in throughout the day once those issues do get resolved. So, if your colleagues are planning on joining, just make sure you let them know also to mute their lines. Video, you're encouraged and welcome to share your webcam. So if you want to turn your cameras on, I can't see you on my end currently, but I'd love to see lovely faces once I stop sharing the slide. Be mindful that you are on display. Turn off your video when you need to. And then Q&A, you can use the chat function to answer. We'll use the chat function to answer questions throughout the presentation. Our speakers will pause during their presentations to answer any questions in the chat box, and I'll make sure to also keep an eye on the chat box and try to moderate and help out where I can. I will drop a note in the chat box so that folks can see where it is. If you have any questions or if you need assistance with any IT related issues, please also use the chat box to message me. You can message me privately if you can't hear or if something's not working, and we'll try to help you work through that. So we're going to start, and I believe all the presenters at least for the first portion of this conference are here. As I mentioned earlier, some did express that they lost power this morning, so I am monitoring that. And if you're looking at the agenda, there might be some presentations that are slated to happen at a certain time, but due to the difficulties that we're currently experiencing, that might move to a later portion. So we do have built-in breaks, and once I have more updates there on the flow of the agenda and whether or not a speaker will be able to present, I will let you know. So I'd like to introduce Michelle Zyland. She is Interim Director of the Office of Healthy Aging, and she will start with some opening remarks.
Hi, everyone. Good morning. I'm not sure if anyone can see me. I don't know what's happening. I'm still seeing Nicole's screen, but oh, here we are. So everyone can hear me and hopefully see me. So I just want to say good morning on this glorious nor'easter day of all days, but we're working through it. So far we have 87 folks in attendance, and I'm thrilled with that. And we're going to do the best that we can to get through the day, considering the conditions. So we're so excited to have you all here today. This is our first annual Adult Protective Services Conference. It's been long coming and long awaited. Mary Ladd, the director of APS, has been working to get this accomplished over the past couple of years. And thankfully, this year we're finally here. So Nicole Arias and Mary Ladd, thank you so much. I know you've worked so hard to get this pulled together today. I also want to thank all of our presenters today. We have a great team of presenters. We're especially lucky to have Elizabeth Petrie from the U.S. Department of Health and Human Services joining us today. Thanks, Elizabeth. Elizabeth will be our keynote speaker. I also want to take some time, a few moments, just to acknowledge the APS staff. And in case you don't know them, I'd like to introduce them. I'm not sure who is on the screen or who is here today, but these folks are the backbone of our Adult Protective Services program at OHA. And every day they make a commitment to doing a very difficult job of keeping people safe in their homes. Mary Ladd, as I said, is our administrator of the unit. Bokai Kamara is our casework supervisor. Linda Tavares is one of our intake coordinators. Michelle DeJesus has just moved to a different position in the unit. She is now our screener, and she will be back up for some other duties in the unit, such as investigations. Catherine Harrington is our self-neglect coordinator. And our abuse investigators are Karen Correa, Patricia Kent, John Ramos, Keith Toast, and Angela Dennett. Karen, I'm sorry, I'm not saying your married name, De Silva. I know her as Karen Correa, so my apologies, Karen. Michelle Boudreau is also an essential part of the APS unit. Her primary role is the SHIP and SMP volunteer coordinator, and she also manages our Project Hello program. But Michelle also helps out with intake and screening in the unit when we need it. Thank you to all of you and your hard work and dedication. I appreciate you, and I appreciate all the work that you do. Our Adult Protective Services program is central to our work at OHA. Safety is one of our leading pillars of our strategic plan. Along with federal and state partners, we are working on strengthening our system by focusing on raising awareness of adult protective services, improving how cases are tracked, monitored, and reported, and enhancing the community support system to ensure individuals are receiving what they need to feel safe in their homes and in their communities. Having said all that, there is still much work to be done. So research shows us that 2 million older adults are abused in the United States, and cases in Rhode Island are consistently rising. From August 2020 to July 2021, OHA saw a 69% increase in APS intakes, an 84% increase in self-neglect and early intervention cases, and a 39% increase in investigations. Huge, enormous. So COVID, although posed its own set of problems and challenges for adult protective services, didn't stop us from receiving cases and doing our work. Although we had to make some adjustments to how we did our work, how we investigated, we continued to do that, getting out into the community, using our community partners to help us. COVID did not slow down the referrals for adult protective services and the work that needed to be done. We are all still feeling the effects of COVID, personally and professionally. It's time to rebuild our safety net, especially around workforce with the direct care supports. Right now, Rhode Island is experiencing a huge workforce issue with direct care supports. And we're working with the community and the Executive Office of Health and Human Services to try and remedy some of that situation. So today is a great step forward to strengthening our APS system. It's our hope to make this an annual event. We are excited for this work, and we appreciate your participation and your commitment to providing services and supports to our most vulnerable populations. So thank you so much for coming. I hope you enjoy your day. We have a great agenda ahead for you. And next up is Mary Ladd. She will be presenting on Rhode Island APS, the 5 W's and how. Take it away, Mary.
Thanks, Michelle. Can everybody hear me okay?
Yes.
Can you hear me? Okay, great.
Yes.
So good morning, everybody. Thank you all for attending. We are really very excited that we're finally able to put on our Rhode Island APS statewide conference. As Michelle said, my name is Mary Ladd. I am the administrator of the Adult Protective Services unit here at the Office of Healthy Aging. And so I have a nice PowerPoint for you folks today. I'm going to share my screen. And here we go. So I'm hoping everyone can see my PowerPoint. Michelle, can you see it? Okay. All right. So what I thought today would be a really good start for our conference is to provide a presentation on what is Rhode Island APS? Why are we here? So we're going to talk about who, what, where, when, why, and how of Rhode Island APS. And so our work is a direct result of the Rhode Island General Law. That would be Title 42, Chapter 66. And these are 7 of the statutes that pertain directly to adult protective services in Rhode Island. And as we go through this PowerPoint, you'll see how we relate on certain things to these exact statutes. So just quickly, there's definitions, duty to report elder abuse, the telephone line to report elder abuse, investigation of reports, obstruction of provision of services, confidentiality of records, and immunity from liability. So let's start off with who we are. We are the Rhode Island Adult Protective Services Unit at the Office of Healthy Aging. We're a statewide unit. In other words, we cover the entire state of Rhode Island. Our unit consists of 11 staff people, including myself. And it all starts with intake. We have 2 intake coordinators. On a good day, right now, one of our intake coordinators, as Michelle Zyland said, is working in another capacity. But normally we do have 2 intake staff. They receive and process our elder abuse reports. We have 2 of our staff folks that do screening of those cases. And once the cases arrive in our office, they are screened to make sure that they fit the criteria for elder abuse, neglect, financial exploitation, and or self-neglect. Our self-neglect cases, once a case is identified as self-neglect, it's sent to our contracted case management agencies to provide intervention and assistance to those particular cases. And then within our unit, we have 5 investigators, and they are our first responders to the elder abuse reports. I also wanted to share some information on our contracted case management agencies. They don't sit within our state office. They are not part of our state office, but they are contracted through our office to provide case management services for our adult protective services clients. So they are also first responders to our self-neglect and early intervention cases. They also receive completed abuse cases that have been completed by investigators if there's a need or request for services in the community. And if so, of course, the client must agree to the referral and the services must be available to the client. So who are our clients? So in Rhode Island, our clients are age 16 over. Throughout the nation, adult protective services can range in the ages that each state responds to the adult protective services, but in Rhode Island, it's age 16 over. These are folks who are reported to be abused, neglected, financially exploited, or are self-neglecting. And really important for those reports that there are allegations of abuse. The alleged perpetrator, there has to be a relationship between the alleged victim and the alleged perpetrator. And according to our law, that's 4266 4.1, it identifies what a caregiver is. And it means a person who has assumed the responsibility for the care of the elderly person voluntarily, by contract, or by order of a court of competent jurisdiction, or who was otherwise legally responsible for the care of the elderly person. So some examples of that would be a spouse, it could be a family member, it could be a power of attorney for health or finances, and it could also be a legal guardian. So there has to be some sort of a relationship between the client, the alleged perpetrator, for instance, if we received a report and it was a situation where, let's say, a neighbor was verbally abusive to an older person, while that's not a good situation, the neighbor is not identified as a caregiver. So I just want to make that distinction there. And what do we do? What do we do here at Rhode Island APS? So as I talked about initially, we're mandated by Rhode Island general law to receive and respond to reports of suspected elder abuse, neglect, financial exploitation, and self-neglect. And we're also mandated to conduct investigations. So according to the law, I just wanted to go through the definitions of what abuse, neglect, financial exploitation, and self-neglect are. So this is right out of the elder abuse law. So what is abuse? There's 3 categories of abuse. The first category is physical abuse, where there's a willful infliction of physical pain or injury. For sexual abuse, it's defined as an infliction of non-consensual sexual contact. And for emotional abuse, it's defined as a willful pattern of mental or emotional harm by threat, intimidation, isolation, or abusive conduct. Financial exploitation. So according to our law, this is what financial exploitation is to an older person. So it's the fraudulent or otherwise illegal, unauthorized, or improper act of using an elder's resources for monetary or personal benefit, profit, or gain. It also is defined as something that results in depriving an older person, age 60 and over, of rightful access to or use of benefits, resources, belongings, or assets by use of undue influence, harassment, duress, deception, false representation, or false pretenses. Financial exploitation seems to be on the rise right now. And I think that when we have our presentation by the Rhode Island Attorney General's office, they'll add some information on financial exploitation because there's currently a new statute that relates to financial exploitation in older adults. So how do we define neglect in the law? It's the willful failure by a caregiver or other person with a duty of care to provide goods, services necessary to avoid physical harm, mental harm, or mental illness to an elderly person. This includes, but not limited to, abandonment and denial of food or health-related services. So that's our definition of neglect. And lastly, is our definition of self-neglect. Self-neglect was not included in the original elder abuse law. It came about some years later, and per definition, self-neglect is a pattern of behavior that directly, imminently, and significantly threatens health and or safety of that person. Or it's the person's inability or incapacity to provide self with food, water, shelter, or safety. So a pattern of behavior does not include, let's say, somebody who unfortunately has a fall in their home and needs to go to the hospital or something of that nature. But a pattern of behavior would be that same person who has had multiple falls at home, and is maybe resistant to services to assist them to remain independent in their home. So that would be the difference there. We look at a pattern of behavior and not one specific incident. So where are our APS suspected victims? They live in the community. They live independently. They can live in their own home. They can live with a family or with a family member or a caregiver, or they can also live alone. Reports of elders that reside in licensed care facilities, for instance, a skilled nursing facility, is not in our purview, and we will hear from our long-term care ombudsman later on today regarding advocacy of older adults who reside in skilled nursing facilities. So when
Mary,
sure.
sorry, I do see a question in the chat. It says, is addiction or alcoholism a pattern of behavior?
So it can be if it has an impact on their ability to take care of themselves. So the person who has a substance abuse issue and maybe is not paying their bills, or they're out driving their car, or they're forgetting to take their medication, yes, that is a pattern of behavior when it affects their ability to take care of themselves. Okay, so when should you report? If you come across an older person and they appear to be abused or they're self-neglecting, when do you have to report? Well, first of all, everybody is a mandated reporter per Rhode Island general law. So if you suspect that there is abuse or self-neglect going on of an older person, you are mandated to report that. All of our records are confidential, including information on reporters. So there are times when reporters want to be anonymous, and that's fine. But also it doesn't give us the ability to reach out to them should we need additional information or confirmation of the information that they gave to us. But our records are confidential, and our reporters are immune from liability. Here's a question we get quite often, probably maybe on a daily basis, and our intake workers can probably really tell you about the number of calls that they receive from reporters or other persons connected with the alleged victim. And they want to know what happened. Hey, I made a report. I didn't hear anything back. Can you tell me what happened? The answer is no, we can't. Unfortunately, we cannot share that information with you because it's the law. There is a confidentiality of records law. I'm not going to read the whole thing to you. It will be on the PowerPoint, and I believe we're sending this out at some point after the conference. But we are unable by law to give that information out to reporters, family members, other interested parties, unless we're working in conjunction with law enforcement, the Attorney General's office, a court, or any type of agency or organization that is assisting us in the protective services of the individual. And here's the other thing we hear quite often. Well, I made a report and I went out to see the client today and everything is the same. Nothing happened. Nobody did anything. Well, there's a part of the law that refers to the older adults' rights to self-determination. So when we get a report here and it meets our criteria, we either have an investigation take place or a self-neglect intervention investigation. Based on what happens during the course of that investigation, we may reach out to law enforcement if it's required, if we know that there's a potential crime that's been committed against an older person, or we may refer that older person for services in the community. But we need the person's agreement to do that. But they also have a right to self-determination. They can slam the door in our face. They can tell us to go away. They can tell us the abuse did happen, but they don't want our help. So we encounter those types of situations on a daily basis. They're adults and they have the right to make their own decisions according to the law. And so the elderly person's right to self-determination and lifestyle preferences commensurate with his or her needs shall be of prime consideration. If the elderly person withdraws consent or refuses to accept protective services, the services shall not be provided. It's tough, it is. And many times we go out and see the same client over and over again because the situation has either remained the same or it's gotten worse. But unfortunately, we cannot force an older individual to accept our help and to accept services. How do you report? So you can call us Monday through Friday from 8:30 to 4 o'clock at this number here. That's our intake line. It's also answered after hours on weekends and holidays by our after hours vendor, which is the United Way of Rhode Island. So you can call 24 hours, 7 days a week, 365 days a year. Or you can enter a report online, which our link is found on our website. It's a secure web intake link. And I've kind of like put an arrow and that's what it looks like. It says report elder abuse. It's right on the main page of our website. Just want to also let you know that we are going to be launching a new web intake form. I know we've had many concerns from reporters about the difficulties that they have in completing an online form. So we are going to be launching a new web intake form. We're currently working on it to make sure that it meets the needs of our staff here, our clients, and those folks out there that want to make the report. So remember that as soon as we have that ready to go live, we'll notify the community. And as a reminder, we've been phasing out fax referral forms for about 2 years now. We still receive them, but we would ask that, especially once our new web intake form is launched, we really need to phase the fax referrals out. Okay, so I just want to spend a couple of minutes talking about our partnership with the Administration for Community Living. First of all, this conference is brought to you by a grant that Rhode Island Office of Healthy Aging received. We applied for the grant. We were approved for the grant back in 2018. And the 4 kind of initiatives of that grant are here. The name of the grant, it's through the Elder Justice and Adult Protective Services, APS grants to states, and our particular grant in Rhode Island. Here's our initiatives. We formed a partnership with our sister agency, BHDDH, and we were able to access a senior liaison that works at BH Link, who deals directly with our APS unit and our APS clients. And you'll hear from that liaison in a bit. Her name is Elizabeth O'Day. We also were able to purchase a new platform for our APS cases, and also so that we can submit the necessary information to ACL for NAMERS, and that's the National Adult Maltreatment Reporting System. The grant also supplied us with enhanced technology. We were able to purchase laptops for our staff and also training. And this conference is part of that training initiative. In 2021, Rhode Island applied for formula funding through the Administration for Community Living. And we were recipients of 2 funding awards. The first funding award has to do with the coronavirus response and relief. grants to enhance adult protective services with responding to COVID-19. And the second funding, formula funding opportunity that we were able to get approved was through the American Rescue Plan Act of 2021, grants to enhance adult protective services. And just wanted to, as I kind of wind down here, I wanted to give you an idea of what our numbers look like in 2020. So in 2020, we received 4,354 reports. Of those reports, 4,331 were sent to screening. And of those 4,331 reports, we screened in 3,710 of those reports. 1,730 of them went to self-neglect. That would be through our self-neglect coordinator and out to our case management agencies. And 1,644 were investigations, and they were assigned to our OHA investigators. There were also 235 early intervention cases. In screened out cases of 631, those are the cases that don't meet our criteria. It could be the person was not 60 yet. It could mean the person wasn't living in Rhode Island. So there's a whole host of different reasons why they would have been screened out. Or it could be it was a scam, in which case we do refer those cases to the Rhode Island Attorney General's office. So I just want to really kind of like focus on the community that we have with our adult protective service partners. It does literally take a community. Our staff here are phenomenal staff. They're highly committed and motivated, as are our case management agencies. But we couldn't really do this alone. So I identified some of those partners here. I kind of ran out of circles, but certainly our partners are our case management agencies, our after hours program, the Attorney General's Office Elder Abuse Unit, our emergency respite program that provides emergency respite funding for elders who might need emergency placement in a skilled nursing facility, the Haven through St. Elizabeth's Community, a safe shelter program, the Rhode Island Long-Term Care Ombudsman, and the Citizens Commission for the Safety and Care of the Elderly. I know I haven't identified everyone here. A couple other folks come to mind, obviously BHDDH and Rhode Island Legal Services, but it literally does take a community. And I just wanted to give a shout out not only to our staff here and our case managers, but to all of our other partners as well. And I am done. Are there any other questions, Nicole, that are in the chat?
So there are two questions that had come through, Mary. In self-neglect, so the first one is, in self-neglect cases, I was under the impression you could communicate with the reporter.
No. I mean, we work with reporters if we need to, but to say that we're able to provide them case-specific information from the case, we cannot do that. We cannot. So self-neglect is also included under the law, the confidentiality of records.
And then the second one is, what if the person has cognitive limitations? And I believe this question had come up when you were mentioning that as adults, as older adults, they have the right to make their own decisions and refuse services.
Right, and that's a great question, because of course we do come across that just about every day. It's called creative casework, that our investigators and our case managers really must kind of like step outside of that box and think of ways to engage that person who may have cognitive issues with the support of, to engage that person through maybe the support of their family, on trying to get them services, things of that nature. So we take steps when we see someone with a possible cognitive issue, or someone who may have, let's say, a power of attorney. We need to take a step further to ensure the safety of that older person, and it can be done in a whole bunch of different ways, but we recognize that and we address that.
Next one is, I agree with the person's right for self-determination and the right for an elder to say no to intervention, but this leaves a majority of our elder population at grave risk. Is there any thought to changing the Rhode Island law?
No, I can't really comment on that now, but I know that some years back, there was efforts to do something along those lines, to kind of strengthen our authority, and it was not well accepted, you know, through the legislators. Right now, there's nothing that that's pending, but certainly we look at the laws every day. We work with the Attorney General's office and local law enforcement, but it's a tough thing, because once you hit the age of 18, you're considered an adult and you can make your own decisions. So it's very difficult to take somebody's rights away simply because they turn age 60.
And two more one is about clarification on reporting if the contact information for the older adult is not valid. So can they talk to the reporter?
I'm not sure if it's not valid. I'm not sure what that means. Can
So
you
the
say?
question is, for clarification, can we talk to the reporter if the contact information for the older adult is not valid? Jennifer, if you want to unmute yourself, feel free to do that if you want to ask that question.
Good morning. The question.
Oh, hi. Yes, Jennifer, now I get it. Yes, Jennifer, you may. If you need to call the reporter, because you're one of our case managers. If you get the case and you need additional information, yes, you need to reach out to the reporter to gain that additional information.
Okay.
If the reporter calls you back and says, tell me what happened when you went out there, that's where the issue begins. Okay.
Okay, yeah, that's the only clarification I was
Okay.
asking for. I figured we could talk to them, but you're like saying no, and I'm going, wait.
Oh,
what?
no. I'm talking about reporters who call us back and ask us.
Okay,
We do
Okay.
reach out to reporters all the time to ask them for additional information.
okay, thank you, Mary, I appreciate that.
Sure.
And then the next one is, what if the person with DPOA /caregiver is a reporter of self-neglect? Would APS be able to coordinate with the reporter under the umbrella of working with the family to connect with services?
So the simple answer to that is yes. You know, somebody's a POA, durable power of attorney, for an older person, and that older person is putting themselves in harm's way, then yes, of course, we would work with them to try and get services for the older adult. Absolutely.
Oh, sorry, one more. Is a person's home cleanliness, sanitation, or hygiene a pattern or behavior for self-neglect?
Yes, it is. Yeah, I mean, if their personal hygiene is poor, and you see that over a short or longer period of time, or their home is unkempt, and that continues to be an issue, then yes, that's a pattern of behavior. Absolutely.
And the last question, Mary, is, does APS have the ability to become involved in advocating for legal guardianship for a client who may lack capacity? At what extent does APS get involved with this process?
So we don't pursue guardianship. There is a volunteer guardianship program here at OHA, but it's very specific to those folks that reside in skilled nursing facilities. If it appears that an older adult, one of our clients, needs an alternate decision maker, such as a legal guardian, we would probably try to work with the family or someone who has a connection to the client to see if they would be willing to take that step. So it's a very complex answer and situation, but we don't pursue guardians for folks. We don't have that authority. We don't have the civil authority to do that as an agency.
All right, Michelle, I see that your hand is up.
Yeah, so guardianship is a very tricky thing, and guardianship should not be pursued. It should be the ultimate last resort. So I just want to make that very clear. We do, as Mary said, have the volunteer guardianship program for individuals who live in nursing facilities who need healthcare decisions made. So it's not a guardian for financial, they don't manage finances, but if someone needs an emergency surgery and they can't make a decision to do that, that's what we have the volunteer guardianship program for. But I just want to stress that, you know, taking someone's rights away permanently is a very serious thing. And we need to, you know, be very cautious when we pursue those type of things and try to resolve those kind of issues, as Mary said, with other alternatives, if at all possible. And so I just wanted to say that we sometimes get referrals for people for volunteer guardians because they're not being cooperative, right? They won't fill out Medicaid applications, or their family won't be cooperative with filling out the Medicaid application. So the nursing home is seeking a guardian so that they can get a Medicaid application completed. Well, that's not a reason to give someone a guardian. So if that person is competent, but is just being difficult, you know, that's not a reason to have a guardian. So I just want to say that we take that very seriously. And, you know, it's always best to look for alternatives before we pursue any kind of guardianship.
So I do see additional questions coming into the chat, but we do have to move along in the agenda. So we'll make sure to respond to those folks individually.
Okay, great. And so thank you, everyone. My time is up. I am very excited and honored to introduce our keynote speaker today, Elizabeth Petrui. Elizabeth works for the U.S. Department of Health and Human Services. She is an aging services program specialist. That's her title. She's going to talk to us today about a federal perspective on adult protective services. But I also want to say Elizabeth has been working as my project manager, or the APS project manager for Rhode Island on our grant for the past 3 years. And so I just want to thank you, Elizabeth, for all the things you have taught me, and I look forward to your presentation. So please take it away.
Well, thank you, Mary, and Michelle and Nicole and everybody who logged on today for today's conference. I'm so happy to join you here today. Let me get my slides popped up. And all right, if we go into presentation mode. Are y'all seeing my full screen slides or the back end?
See your next slide, the back
You see
end.
my notes and stuff? Okay.
Yeah.
Let's switch this. How's that look?
It did not change. Oh, that's better. Yes.
Okay, wonderful. All right. My name is Elizabeth Petrui, and as a visual introduction, I'm a white cis woman in my late 20s. I have red hair and glasses, and my pronouns are she, her. It is an honor to be here representing the Administration for Community Living. As an aging services program specialist and project officer within the Office of Elder Justice and Adult Protective Services, and yes, that is a mouthful, that is our full office name. It's been my pleasure to work with Mary over the last 3 years on Rhode Island's Elder Justice State Grant. And I've been so thrilled to see the progress made, including, as Michelle and Mary have referenced, this conference taking place here today. Because of my role as a project officer, I hear about the struggles and accomplishments of APS workers and departments every day. I know how hard what you are asked to do is, and I know how committed you are to the people that you serve. Adult Protective Services is the safety net when all other support systems have failed. ACL is committed to supporting APS and continuing to build the field together. We are building the Adult Protective Services of tomorrow, or rather you are building the APS of tomorrow, and the federal government through ACL is supporting those efforts. We are enhancing existing supports and in some cases building new supports for APS to ultimately better serve APS clients. So there is my title again. When I talk about the APS of tomorrow, I'm talking about one element of what we call ACL's vision for elder justice. I have that up on the screen, but I'll go ahead and read it as well. A comprehensive multidisciplinary approach that effectively supports older adults and adults with disabilities so they can exercise their right to live where they choose, with the people they choose, and fully participate in their communities without threat of abuse, neglect, or financial exploitation. And I would include self-neglect in there as well. While I'm here today to give a federal perspective on the many exciting developments in the APS field, I just wanted to mention briefly that ACL supports several other components of the elder justice field more broadly in support of that vision. And so in addition to our APS focused projects and initiatives, my office works on legal assistance to older adults, income security, and elder abuse prevention efforts more broadly. And we work hand in glove with the Office of the Long-Term Care Ombudsman Program. So you can see our the range of our portfolio laid out there. Now, in terms of grants, it has been an incredibly exciting year. In April, as Mary mentioned, ACL was able to award over $93 million in grants to every single APS program, all 56 states and territories, to improve their ability to provide protective services in light of the COVID-19 pandemic. That was through the Coronavirus Relief and Response Supplemental Appropriations Act, and it was historic, first time ever federal funding through the Elder Justice Act. In August of this year, we followed up that funding with an additional $86 million through the American Rescue Plan Act. This funding was once again available to every state and territory and is even more flexible in terms of what it can be used for. As part of that funding through the American Rescue Plan Act, APS programs are creating 3 to 5 year operational plans with the help of subject matter experts in strategic and operational planning, which we hope will lay a strong foundation for the third round of funding, an additional $180 million coming to APS programs in 2022. While we are hopeful there will be additional federal formula grant funding beyond 2022, we want to ensure that APS programs are set to make long-term investments with the money that's available now. These funds are being used by states for a wide range of purposes. Just like our elder justice state grants, we are seeing trends towards shoring up APS infrastructure, for example, through expanding or developing new information systems, case management systems to be able to report to neighbors, equipping staff with technology that enables them to do their work more nimbly in a remote environment, and being able to expand direct services to APS clients, as well as case management or care coordination. But we've also seen some really interesting innovations, and I don't have so much to report yet, only because these grants are so new and we don't have our first progress reports back. But there are some really interesting ideas being piloted in terms of shared services of specialists. We have many states that are very concerned about the financial exploitation of older adults who are partnering with forensic accountants. So it's just an incredibly exciting time. In September, we announced that the National Adult Protective Services Association had been awarded a grant to create and launch our new National APS Training Center. The training center will provide up-to-date, relevant, practical, and consistent training to APS workers and supervisors across the country using an e-learning platform. At every stage of the project, the training center will engage with APS workers and supervisors to better understand workforce development needs, inform project activities, review curricula, and propose dissemination strategies. This will include engagement around issues of equity, racial justice, and equal opportunity in order to better equip APS staff to support clients from marginalized and underserved communities. Our goal is to have a platform launched and the first modules available early next year, so please stay tuned for more information. Also last month, we announced 14 new Elder Justice Innovation Grant Awards, 7 to the highest courts of state for Alaska, Massachusetts, Maryland, Minnesota, Nevada, New York, and Oregon, to assess the fairness, effectiveness, timeliness, safety, integrity, and accessibility of adult guardianship and conservatorship proceedings, and to develop innovations to improve the experiences of individuals at risk of guardianship or conservatorship. And I was so happy to hear you all discussing the importance of autonomy and self-determination. As we all know, guardianship and these issues have been in the news, and it's so critical that we make sure that guardianship is really limited and only targeted, as Michelle mentioned earlier, as a last resort. In some cases, guardianship is referred to as the civil death penalty. It is a really extreme approach, and it strips someone's civil legal rights. We made an additional 7 grants to researchers working in concert with APS programs to assess and understand the various community services that produce better outcomes for individuals transitioning from short-term APS interventions to the broader community-based services and programs, such as Older Americans Act programs, that remediate and prevent recurrence of abuse over the longer term. We expect to make more of these awards next year, and that forecast is already available online. And I apologize, there was a incident at our office in DC. I am working from home, but I'm getting a lot of phone calls about it. So I will, if you see me turning anything off, that's what's happening. Last year marked the start of 2 elder justice state grants focused on enhancing APS services in light of the opioid epidemic. Montana and Nevada are piloting approaches with the intent to wrap up and disseminate their findings in the next year. We know that cases that involve substance misuse, either by the client or the alleged perpetrator, are more complicated and take longer on average to resolve. And we hope that these grants will demonstrate new promising practices on how APS programs can successfully approach these cases. We know that these grant projects require extra time, flexibility, and patience, and we appreciate your partnership with researchers, project staff, and all of us at ACL. As Mary acknowledged, we've been in this together for 3 years, and it's not easy, but it's important. Beyond grants, ACL supports a number of resource centers and other systems level projects and initiatives that provide direct technical assistance and advance the field in terms of building evidence. ACL continues to support the APS Technical Assistance Resource Center. The APS TARC, along with our other elder justice resource centers, such as the National Center on Elder Abuse, the National Long-Term Care Ombudsman Resource Center, the National Center for Law and Elder Rights, and many others, assist direct service providers such as yourself. You can learn more about our various resource centers by visiting www.elderjustice.acl.gov. The mission of the APS TARC is to support federal, state, and local partners' use of data and analytics, research and evaluation, and innovative practice and strategies to enhance the effectiveness of APS programs. APS programs can call or email the TARC with questions or requests for technical assistance via the website, which is apstarc.acl.gov. The APS TARC is critical in the development of the APS of tomorrow, and I would encourage all of you, if you haven't already, to sign up for their listserv. They host email conversations as well as peer-to-peer calls for APS workers, supervisors, and administrators, along with a wide range of webinars, briefs, and toolkits. This year also marks the 5th year of data collection for the National Adult Maltreatment Reporting System, or NAMERS. I'm not a data analyst, but I know, as I'm sure many of you do as well, that the more data you have, the fuller picture that starts to emerge. The APS TARC has been hard at work analyzing 2020 NAMERS data, and the 2020 report is now available online for any of you to peruse. This year's report also includes a chapter on what we know about the potential impact of COVID-19 on APS. It's not the full story because, as we're all painfully aware, we're not out of the woods yet when it comes to the pandemic, but we are laying the groundwork for hopefully more fulsome research in the future once we're out of the woods. What's most impressive is that we have had 100% participation from all APS programs again this year in submitting information to namers. We want to recognize the efforts of all involved who helped achieve that goal and are thereby advancing our knowledge and understanding of adult maltreatment. Reporting to namers takes work. You have to map your data to the namers data elements, and everyone who compiles or collects any information is part of the process of the value of the information and your commitment to improving the lives of the people we serve. As you know, absence of data for research and best practice development has been cited by numerous entities, including the Government Accountability Office, as a significant barrier to improving APS programs. Policymakers, APS programs, and researchers use the data from namers to evaluate and improve programs. In the last few years, ACL and the APS TARC have been gearing up for the coming reauthorization process for namers. Over the summer, we hosted 10 listening sessions to hear from the field, and we are in the midst of arranging for the next steps to present what we heard at those listening sessions back to the states for your feedback. In addition to data, ACL has facilitated the development of the voluntary consensus guidelines for state APS programs to assist states in developing efficient, effective APS systems. Overall, the guidelines are designed to provide APS administrators with recommendations from the field about quality practice. There are several ways that states may choose to utilize the guidelines as a model of comparison to existing APS systems offered, to identify new areas of interest, or to identify areas for improvement in current state statutes or policies. The guidelines were first developed in 2016, and we wrapped up their first update last summer. Those are available on our website at acl.gov. The final guidelines do not constitute any standard or regulation and do not create any new legal obligations, nor impose any mandates or requirements. This update reflects the latest research and best practices in the field of adult protective services and elder abuse. As part of the update process, we also created an APS research agenda and a tools inventory. The research agenda will guide our future funding opportunities, and the tools inventory is a resource for folks like you working directly with clients to understand the level of evidence associated with various instruments and assessment tools, which populations they're appropriate to be used with, and who can administer them. Another exciting project that I hope to have more information to share about soon is the work underway between ACL, CMS, the Centers for Medicaid and Medicare Services, and other partners to use predictive analytics and develop an algorithm that will actually take into account risk factors for future elder abuse. Adult protective services give us at ACL and your clients hope. You inspire us, and we're so grateful to you for the intensive work needed to do your jobs each and every day. We are proud to partner with you to build the APS of the future, person-centered, trauma-informed, evidence-based, and fully funded. My email address is spelled like my name, elizabeth.petrui@acl.hhs.gov, and you can feel free to reach out to me if you have a question or want to know where to find more information about anything I mentioned earlier. And I'm also happy to answer questions now if anyone has one. Thank you.
Thank you, Elizabeth, for sharing that important information. Questions can again be typed into the chat. I'll read them out and Elizabeth will answer.
See if I can stop sharing. There we go. I am also fine to not answer any questions. But if it comes to you later, you can feel free, Nicole or Mary, if you want to include my email address and any materials you send out, I'm happy to answer questions later as well.
All right, perfect. No one has any questions. We're just going to take a quick break, reconvene at 10:30, and we'll hear from Elizabeth O'Day, who's the Director of Healthy Aging Services. So see everyone back at 10:30.
Thank
Enjoy
you,
your
Elizabeth.
You're very welcome. Thank y'all. Have a good day.
You too.
All right. So welcome back, everyone. Again, thank you so much for taking the time out of your busy weeks to be here. And I'm hopeful that you've been enjoying the speakers that we've had so far this morning. And as I mentioned, questions can be added into the chat. So as you're hearing the presenters, unless they have a pause for questions, feel free to pop them into the chat. I'll keep an eye on that and monitor and ask questions where appropriate. The next speaker that we have lined up is Elizabeth O'Day. Thank you, Elizabeth, for being here. Elizabeth is the Director of Healthy Aging Services, and Mary had spoken earlier about her being the liaison for BH Link and Horizon Healthcare Partners. So she's here to speak to us and give us an introduction and overview of BH Link. So I will let you take it from here, Elizabeth. Thank you.
Thank you, Nicole. Good morning, everyone. As Nicole said, I'm Elizabeth O'Day, and I'm from Horizon Healthcare Partners, which I'll refer to as HHP, and Behavioral Health Link, which I'll refer to as BH Link. And I serve as the liaison between both BH Link, HHP, and the Office of Healthy Aging. I'll just be sharing a brief overview of the work of HHP and BH Link, and we'll be reviewing my role in regards to working with all of you. HHP is contracted by BHDDH to operate BH Link. Community Care Alliance has taken the lead with the clinical aspect of the program, with Kodak taking the lead with the substance use disorders or SUD support. HHP is a nonprofit, tax-exempt organization assisting but not replacing the community mental health organizations. It's a voluntary program that accepts people with health insurance as well as those with no insurance. When we use the term partners, this refers to HHP acting as a hub on behalf of Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services. The facility is located on Waterman Avenue in East Providence, and there is a call center whose phone number is 414-LINK or 414-5465. There is also a triage crisis center that provides immediate treatment and recovery services, as well as connections to long-term treatment options. The environment itself is welcoming, and services are provided by a competent, compassionate team of registered nurses, counselors, phone screeners, and peer specialists. There is help available 24 hours a day, 7 days a week. We also possess a mobile capacity called MCAST, which stands for Mobile Crisis Assessment Support Team. This team consists of a clinician and an EMT, emergency medical technician. And once a person has been medically screened through BH Link, this team will go out into the community with the MCAST van for crisis intervention. This resource has its limitations and with its availability to reach all of Rhode Island, but partners with the community mental health centers periodically when necessary to reach other parts of Rhode Island that they're not able to access. A major goal of BH Link is to divert people from emergency rooms, police, fire departments, and the like. We want them to have a more supportive, appropriate care environment. It's a better fit for people struggling with mental illness and addiction, and it's economically sound for the state of Rhode Island. Although police officers, firefighters, emergency room personnel are all trained to work with diverse populations, the staff at the BH Link are all medical professionals trained only to work with behavioral health issues, and that makes all the difference. As for my role in all of this, I'll mention again, I serve as a liaison between the Office of Healthy Aging and BH Link. I'm striving to expand the knowledge of this resource with Rhode Islanders' older population. I'm out at various agencies throughout the state, such as senior centers, community action programs, food pantries, and the like. Wherever I'm invited to share about BH Link to an older crowd, I'm there. I've also been known to invite myself to places if I believe the BH Link resource would be beneficial to the older adults that go there. It's all good. As far as the APS unit goes, I receive calls to consult on cases which contain behavioral health or substance abuse component. I contribute to ensuring individuals are taking advantage of all resources available to them. I'm also available to go out with the first responders and for in-person, in-home visits, and sometimes site visits. I share the BH Link information, but I'm also there supporting the APS responder with the common goal of assisting older adults with compassion, dignity, and respect. Although the cases may have many common denominators, no two cases are alike. Another plus with my experience in this unique position is my ability to assist with identifying the direction the needs of the people we serve are leading us. This contributes to our goal of remaining as spot on as possible when it comes to assisting with these needs. I am pleased and yet encouraged to be yet another voice amongst many doing great work in Rhode Island, seeking solutions for the issues and challenges facing our fellow residents over 60. Many of you have generously reached out to me during these, my first couple of months in my current position, and I would like to take a moment to express a sincere thank you. You've been instrumental in putting me on the fast track to learn more about what there is to know about serving the older adults in this state. Your input's been invaluable to me. I appreciate being invited to speak here about Horizon Healthcare Partners and the Behavioral Health Link. And I'm sure that this virtual conference will be one of many, and maybe next year we'll actually all be able to meet in person. For those of you who do not already have my contact information, I will add it to the chat. And I encourage any of you to contact me. Of course, when there is a crisis that you are requesting support, but also if you simply have questions or concerns that you feel I would be able to help with, or simply just to say hello. So thank you very much and enjoy the rest of the conference. If anyone has any questions, I'd be happy to answer them.
Elizabeth, I don't have a question. I just wanted to say thank you so much. That was a great presentation. And thank you for your partnership with us, our APS staff, our clients. Thanks again, Elizabeth.
Oh, you're most welcome, Mary. It's a pleasure to work with you as well. Thank you for your kind words.
All right, if there are no questions, we'll move right along to our next presentation. We do have someone from Rhode Island Legal Services, Adela. She's a social worker on the Elder Protection Project. And Adela, thank you for being here in lieu of Steve, who unfortunately doesn't have power right now. So thank you for picking up the ball and being so willing to talk about your initiatives over at Rhode Island Legal Services and what your team does.
Hi, thank you, Nicole. Yes, I am stepping in for Attorney Steve Bajan. One of my coworkers, he unfortunately does not have power, so I've been asked to kind of step in. So I am the social worker at Rhode Island Legal Services. I'm the only social worker at Rhode Island Legal Services. I work in 3 of our units. The Elder Protection Project is one of them. I also work in our Safe Family and our Housing Stability Unit. Our Elder Protection Project, we focus a lot on obviously helping people over 60 who are facing abuse, whether it be financial, physical, sexual, emotional, any kind of abuse. We try and do our best to help them by doing restraining orders. We help with divorce cases. Very once in a while, we have help with custody battles. Not many of our elders have kids who are minors, but occasionally it does happen. We also assist with bankruptcies. A lot of the financial exploitation cases leave our clients in debt. So we try and help them clean up the mess by filing a bankruptcy to help liquidate what was done to them. Recently we have been trying to help abandoned elders who have been left at hospitals by coming in as a temporary guardian to help them get out of the hospital setting that they're in and get them safely placed in a more appropriate setting, such as a nursing home or assisted living. I assist Steve by doing the LTSS application for Medicaid, while Steve works on more the legal end things. There has been challenges with this, but we are working to try and help make it a more smoother program so that the elders get the help they need and that everyone kind of works together in Rhode Island. So it's been rewarding so far. That's our elder unit. We are a nonprofit law firm, so our services are free to the people that we do assist. There are certain programs do have a income guideline cutoff, but for elders there usually isn't one. We can usually make it work unless the elder has like $1 million, then usually we can't assist with that. But for the most part, we make it work to help everyone we can. That's for our elder program. We do have the other units, like I said. We have the Safe Family Project, which is domestic violence. We do restraining orders for anyone basically under 60 and over 18. We do the divorces and custody cases there as well. We have the public benefits unit. So a lot of people who are on state benefits, if they have issues with their benefits, they can actually call us, and we have an attorney on staff who can help figure out what's going on, help them file appeals, to correct their SNAP or their Medicare, their Medicaid, what it may be. Their Social Security benefits, so it's really a great unit to have. We have the Responsible Parent Project, which helps parents who have to pay child support basically try to avoid going to jail and keep them paying their child support, so that way the child gets the care that they need. We have the Family Preservation Project, which is our clients who have children in DCYF custody. We work to help the parents regain custody by making sure they complete all their programs and all their steps to make sure that their child's coming home to a safe environment. We have the Housing Stability Project, which is big. That's our eviction program. So a lot of people who face eviction, we give them free legal representation to help prevent the eviction. Usually we create stipulations to help clients pay back the back rent that they owe, or if it's a behavioral reason, we work together with me to try and find out what's causing the behavioral problem, and we try to solve it so they can keep their housing and stay stable. Those are the busier projects that we have. Everything kind of works together, and that's the gist of Rhode Island Legal Services. I don't know if anyone has any specific questions or wants me to go into more detail about anything else.
Adela, there is a question in the chat.
Okay.
Does Rhode Island Legal Services assist elders with evictions?
Yes, we do. So if the eviction case is abuse related, like the landlord's abusing the elder, or if the elder is actually a landlord and has a tenant abusing them, they would be put into our elder protection project and would work with either attorney Steve Bajan or attorney Eric Beither. They would talk to Amira, who's our paralegal. She would complete the intake to make sure we get all the information and know what's going on. If the eviction is just a regular eviction with non-payment, or maybe the person's having behavioral reasons, they would be sent to our housing stability unit, and then they would assess by one of the several attorneys in that unit to assist with the eviction case. We would, like I said, sometimes they do stipulations, which creates a payment plan for the person, or if it's a behavioral reason, they work with me and we try and get to the nitty gritty of what's causing the problem.
Perfect. So there are a few questions now.
Okay.
How successful have you been with placing seniors that have been in long-term in hospitals? So I think that's long-term care.
Yeah, LTC, long-term care. So we've been pretty successful getting them placed. The hiccups more been trying to get a healthcare guardian in place, because there has been a lot of changes, and we're trying. There's not enough volunteers at this point, which is the other big hiccup. So Steve comes in as the temporary guardian to at least get them into a stable facility. Right now we have, I think, about 6 cases open. One unfortunately has passed away, but we had about 6 of them, and all of them are currently placed in a nursing home setting now. So we're just waiting for the next piece of getting a volunteer guardian to take over the healthcare piece, and then the financial piece, which is the hard part. That creates the hiccup. I file the Medicaid applications with Steve. I fill them all out. Steve signs them. We collect as much documentation as we can. I write a letter to DHS explaining why the Medicaid app may be missing pieces of documentation due to the elder being deemed incompetent and we can't get the paperwork. So far, DHS has been working with us because they understand that it's out of our control and the elder's control. So they have been placed safely at this time, the ones that we do have. Sometimes it takes longer for certain ones versus others, but we can't say it's moving along. It's just the part getting a healthcare guardian in place to officially wrap everything up neatly.
And then the following question to that was, is Rhode Island Legal Services the appropriate if a client is in need of a volunteer guardian?
So technically, no. We don't do the volunteer guardianship piece. We do the temporary limited guardianship. Anyone who needs a volunteer guardian should contact the volunteer guardian program through OHA, because they're the ones that will basically advertise that a volunteer is needed to take on a ward. We just step in for that middle piece to get the client from the hospital into an appropriate long-term care situation, whether that be a nursing home or assisted living. But we don't actually volunteer for the full healthcare piece or financial piece.
A few more questions in here. What are some community partners you work with?
So I know that we work with a lot of law firms in the area. We have a lot of back and forth with them because we're a law firm. But since I've been there, we do talk with OHA. We talk with DE, or formerly DEA, the Office of Healthy Aging. We talk with Department of Human Services. We work with SAGE Rhode Island. We work with the Jim Langevin office. We work with the Attorney General's office. We have been trying to get more involved with the community action programs, because obviously our elders are in the community and I like them to know where their local CAP agency is, so they can get closer resources to home. We work with Social Security in the PBU unit. We try and work with all the housing authorities because a lot of our eviction matters usually happen in subsidized housing. So we try and work close with all the different housing authorities in the area. And I think those are the biggest ones we work with. There could be more that I'm not sure of, but I know that's the most of them anyway.
Sure. Okay. And how do you make referrals to Rhode Island Legal Services for an elder? And are you also a member of the Unitas platform?
I do not know if we're part of the Unitas platform. That part I do not know. But to make a referral to us, they can just call us at it's 274-2652. And they'll get connected to the secretary, and they will explain the problem to her, and then she'll dispatch them to the correct unit and speak to that paralegal for that unit to get the intake process started.
Questions are coming in hot. How can an elder get a healthcare guardian if they have no family?
So we would direct them to the volunteer guardianship program. Again, it's not something that RILs can do full time. So usually I know Michelle Zylan does work with the VGP program. So we fill out the application and usually send the referrals to her office. And then they work on trying to get a guardian in place if there is a volunteer available willing to take on the case. It's a big need, and it's just not enough volunteers at the current time, it seems like.
Next question is, do you help elders who are in their home with DHS, Medicaid, LTSS applications if they are having problems?
So we do. It depends on the case. I have helped clients with the LTSS application several times. If they come into our unit as, you know, whether it's an abuse issue or some type of other housing issue, or just kind of wrapped into our law firm for a reason or whatnot, I can usually help with paperwork. Sometimes if it's not something we can do because we can't take them on as an actual law client, I will find a social resource that can help them, because that's the biggest thing. Like, we're not a social service agency, we are a law firm first. So they have to have a legal issue that we can take on. And then once they're in under that issue, they get me as part of the legal problem. So then I can help with some social issues that may be causing the legal problem. But if they're looking for just social help, we usually can give them contact information to call who can help them more hands-on for that. But again, it's based on the situation itself. I mean, we don't turn people away if there's something we can at least give them information for.
Question is, Rhode Island Legal Services a good resource to have the elderly client contact if they are low income and are in need of legal help with any issue, or does Rhode Island Legal Services only help with the specific issues that you mentioned?
So we're a civil law firm. So as long as if they're an elder and they're not being abused, we have other programs in our unit that if they fit that criteria, we can definitely send them to that unit instead. But again, so as long as it's a civil matter and it's an issue that our law firm works with, we will find the appropriate unit for them. If they're facing a criminal matter, we don't do criminal at this time. So we would definitely give them at least a referral to where they can go to. A lot of any clients usually can't help, we usually send to the Rhode Island Bar Association, because as an elder, you get a 30-minute free half hour with an attorney to discuss your case with. And then they can kind of ask their questions about their situation, and they don't have to pay for the half hour, it is free. And then they can discuss whether they want to hire the attorney they met with, or now they have the additional information that they needed, they can find a different attorney they feel more comfortable with hiring. But it is civil for us, but if anyone calls us, we don't leave them empty-handed. We always try and give them at least somewhere they can turn to if we can't help.
Question, if someone is facing immediate eviction, how quickly can Rhode Island Legal Services step in and assist?
So as soon as they get served any eviction paperwork, they're to call Rhode Island Legal Services right away. They tell the secretary again why they're calling, and if they have a court date, the housing unit will be informed rather quickly that there is a date coming up. And then once we review the paperwork, the attorneys, if it's something that we do handle, they can decide to, they'll answer the court documents and then schedule to be in court. If by any chance if we're told like very last minute and their attorney can't get there, we will advise the client to ask for a continuance to get an attorney. Most courts work with that. They can say they've already contacted our legal services and they're the ones that suggested to have a continuance. Most judges know us and work well with us, and they usually will grant the continuance to give the attorney time to read up on the case and make sure that the elder has representation.
Perfect. So I do want to note that, as mentioned, after the presentation, I will be sending around to all participants helpful links and information from our presenters. So I see that there is a really good conversation happening here in the chat about the guardianship program. Michelle, if you want to chime in and provide some clarity on OHA's portion of the guardianship program, I think that'll help clarify some of these questions as well.
Yeah, so this has all been really great and helpful information. So for folks who are in hospitals who have no place to go and need a decision maker, that's when Rhode Island Legal Services comes in. Steve Asian becomes the temporary guardian. They make the placement in the nursing facility, and then the volunteer guardianship program will take over. So we locate a guardian. We work with the Rhode Island Bar Association to get a pro bono attorney who files the petition in court. And then at some point, the volunteer becomes appointed as the healthcare guardian. It's called a Good Samaritan guardian. And so they only make healthcare decisions. We don't do guardianships for people who live in communities, who live at home on their own. We do some limited volunteer guardianships for people who live in RIDE class group homes, who have IDD issues and need a decision maker for surgeries or medical reasons. So just to keep in mind, the volunteer guardianship program is for folks who are 60 and over, who reside in nursing facilities or other community settings, such as assisted living or a RIDE class group home. I left my phone number in the chat if anyone wants to call and ask more specific information. We can provide some documentation on that program when Nicole sends out the documents.
And then for Rhode Island Legal Services, do you have contact information that we could share with the group on the volunteer program as well?
So you can just call the office directly and they'll send us to the elder unit. It's the 27, I can put it in the chat, but our number is 274-2652. They can call that number directly and they can express they can ask for the elder unit when they speak to the secretary, and they'll get directed to Omira, who is our paralegal, and she does all the intakes. And then we try to meet once a week to go over all the intakes that come in. They get assigned to attorneys, or sometimes, I mean, they can be, some are just advice, but they'll get assigned an attorney. They'll get a chance to talk with one. If it's a case that we can't handle, again, we will refer them to a proper agency that can assist them if it's something that we can't do. But I'll add our number in the chat just so everyone knows.
Awesome, thank you so much. And again, as mentioned, I will be following up with all participants with additional information and resources from today's conference. So thank you so much for taking the time. If no one has any other questions, we're going to take a quick 10-minute break. We're actually really ahead of schedule, which is nice, but that means our presenters that had a lot of time to be here aren't available yet. So next up, we'll hear from the Commission on the Care and Safety of the Elderly, and we'll start that presentation in about 10 minutes. All right, welcome back, everyone. Our next presentation is from the Commission for Care and Safety of the Elderly. We have Michaela Driscoll, Elder Abuse Investigator from the Office of the Attorney General, and Denise Owens, retired Narragansett police officer, and also a member of the Commission for Care and Safety of the Elderly. So I will pass it along to Michaela and Denise for their presentation.
All right, thank you, Nicole. Good morning, everyone. I'm Michaela Driscoll. I'm the investigator in the LWC unit at the Attorney General's office. I'm going to share my screen because we do have a PowerPoint presentation. So just give me a second. All right. Denise, I think if you want to take it away.
Okay, and I'm Denise Owens. I'm a retired Narragansett police officer and was actually the second senior police advocate in Narragansett. When I left there, I actually became the project coordinator and assistant director for the Justice System Training and Research Institute at Roger Williams University, who has also actually worked with the commission on several things, which I'll mention as we go along. So going to the next slide, the history of the commission and the relationship with DEA or OHA now goes way back. The commission was created in 1986 under Rhode Island General Laws, Chapter 12-1.4. Anna Tucker, who was the director of DEA years before, and Anna Pryor actually worked this through the legislature. Under the actual law, the purpose of the commission is to act as a liaison between the legislature, public safety officials, Department of Elderly Affairs, now Office of Healthy Aging, and the older population of Rhode Island in the area of crime against the elderly, injury and fire safety, and protective service options available to the elderly. Primarily, the commission is responsible for putting together and facilitating training requirements for police senior citizen and fire senior citizen advocates. It was originally primarily police, but over the years, the importance of fire prevention and injury prevention became more important. So many of the fire departments have actually created this position within their agencies. We offer an annual conference, which has been somewhat curtailed over the last year or so because of COVID, and we're in the process of probably trying to put something together in the spring. Our audience originally was mostly the police senior and fire senior advocates, but we've expanded it to agencies similar to which are attending this conference. We identify current issues and trends facing the elderly population in Rhode Island with input from the Office of Healthy Aging. We traditionally meet only 4 times a year. And we very often meet at the Office of Healthy Aging. Office of Healthy Aging has worked with the commission as the secretary and assists very much with the planning and facilitation of that training on the annual basis. I think one thing that really struck me in Mary Ladd's presentation, and it's absolutely true, it takes a team to really provide the services needed for the protection, the safety and care of the elderly. So with that, Michaela's going to talk a little bit about the current membership of the commission.
Sure. So currently the chair of our commission is the retired fire chief, Chief Richard Susi. There are of the membership, there are statutory members who are essentially have a statutory position on the commission. One of those is the fire chiefs, the police chiefs, who currently we have Sid Wardell, who is sitting on representing the fire chiefs, the Police Chiefs Association, the Fire Marshal's office, which is Vin Quinterno, who is the statutory member. Myself, I'm the statutory member from the Attorney General's office, Trooper Crystal Carvalho from the State Police. And then we also have community members and different senior service providers who are members. Those senior service providers, and this is something that we are still in the process of working on in terms of getting changes in the legislation for our commission. So we're kind of out there and and more known, if you will. But there are seats that are put into place by the Senate President and also from the House, the Speaker of the House. So right now we do have some community partners and providers who are part of our commission. You can see the list that's here. Obviously Denise is one of those. So like I said, there are statutory seats that are provided by certain agencies, and then the seats that are appointed, the individuals that are appointed.
And just one quick thing.
Sure.
Also, Mary Ladd sits on the commission, and the vice chair, Jack Quigley, who's a community member. They were just left off that slide, so that's my omission.
Can you say that again? My watch is done. That's
Okay.
okay. My watch apparently picked that up. Sorry about that.
So there are police and fire advocates in all city and towns in Rhode Island. Fire advocates are a little bit more difficult because many of the cities, actually more of the towns, have volunteer fire departments. So sometimes they may not actually have a fire advocate. The roles and responsibilities of the police and fire advocates are to respond for calls for service from the elderly, investigate criminal complaints against the elderly, and provide presentations and information on crime, fire, and fall prevention materials to the elderly population. It's interesting because in many of the police departments, it's a patrol officer who serves in this capacity. And in the fire, it kind of moves along. But many of the times, the fire department will come across a senior that needs help, and they'll connect to either OHA or the agency that is the appropriate one. We work with OHA and the Rhode Island Attorney General on investigations. The senior advocates do. Some of the activities that they do beyond investigations. I know when I was in Narragansett, we did home visitations on a regular basis. We identified basically seniors who were alone in their homes, who maybe didn't have family that would be able to visit on a regular basis. And we would spend a good part of the week going out to visit different seniors. And that happens in many communities throughout the state. Some police departments have volunteer opportunities. And that was invaluable to us because when I would go out in Narragansett and visit with community members, I actually had a senior volunteer that would go out with me. And it was nice to be able to have him be able to connect with the seniors that we were visiting as well. They also coordinate and share information and resources by advocates in different regions of the state. When I was a senior advocate, we would meet in the South County area with someone from the Department of Elderly Affairs. At that time, they were pretty much assigned to different areas, and we would not using names or anything, so there wasn't the issue of confidentiality, but we would discuss different cases in different ways or get different ideas of how to help the seniors in these particular different situations. And many of the senior advocates do presentations at senior centers or at elderly housing. That's a pretty regular basis. They can do it on a wide variety of topics. One of the issues for us is the list of advocates needs to be updated on a regular basis due to promotions and retirements. And to keep in mind that senior advocates in some police departments are on different shifts. So it can be difficult to connect with them, but it would be good if you're interested in connecting with the advocate to also be able to have them help you identify someone else on a different shift that may be able to help you if that's what you need. Because of the turnover, and as I just said, there's a constant turnover both in police and fire. The annual training is really important for a number of different reasons. One of them is, I think one of the things that I learned when I first became an advocate, AARP partnered with us to create a week-long training. And we talked about communicating with the elderly. And an example I can think of that always stood out in my mind is when somebody doesn't hear as well, yelling at them does not make it easier for them to hear, but speaking directly so that they can see your mouth helps, because many of them lip read. So it's those little kinds of tips that we can provide at training that can help. And the annual training also gives them a chance to meet and interact with advocates who have been around for a while to get new ideas. And it also gives us an opportunity to teach them the roles and responsibilities of their job and to provide resources that will be valuable to them in this role. Our connection to APS, we've traditionally worked very closely with APS on investigations and complaints. They're a resource and partner in advocating for the elder population, the senior advocates are. One resource that I want to just mention quickly, there's a great resource for anybody that's dealing with elders who have Alzheimer's. The International Association of Chiefs of Police has a number of videos that can be extremely helpful if you have a missing Alzheimer patient or with different issues that Alzheimer patients face. They have a number of different really good videos that you may want to pull up at some point. So the two key roles for the advocates are prevention and investigation.
And I'll just mention, Denise, and this is something now I'm looking, because to go back to the other slide of our membership, this was 100% my fault. I sent myself, because as many of you will relate, I don't, on my office computer, I don't have a camera, so I have to use my own computer. And I forwarded myself the draft presentation versus the actual one. So I will I will change it. I just sent myself the other one. So I very much apologize. There was just there's one last slide with our contact information that I'll put up at the end. But just want to, really kind of reiterate there that it's really important to be able to work with, especially, the police advocates, know who they are in your cities and towns. As Denise said, they do change often. And it's not necessarily that person is on the first shift. They're not going to necessarily work the same shift that you do. I know that there are senior advocates who work the third shift, but do get copies of all of the reports that are made. So it's really important to make sure you know who your senior advocate is. We tell people in our presentations for the for the elderly folks, the people in the community, know who your advocate is at your police department. So if you know that you're a victim, that's someone that you can reach out to themselves. And it's really important to know if you're in a kind of a crisis situation that you need to reach out to the police. Your advocate in your town works the third shift. Be able to reach out to the police department, ask for an officer who's on duty, and that's someone that you can talk to make sure that they can, act immediately versus waiting for that individual to get the report. Same thing we know goes, if someone is on vacation, make sure that if you're reaching out to the police department and your officer is not there, that you have someone that you can then speak to and utilize them. There have been cases where we've had to call the police when we're out on specific calls for whatever reason it may be, know who they are and really be able to utilize them because they're really important tools. Like I said, we know that it changes often. So having that connection and having that communication with your police department is very important.
And the other piece of that is that they are very often the people that will go, the officers that will go above and beyond. So please do call, because the chiefs have been careful in picking people that they think will do this job well.
Absolutely. All right. So I think all of our slides besides our contact information at the end are the same. So again, I apologize for that. Just technology and how it goes here. So one of the things that we are planning on is to have a spring training. Hopefully we can again have that in person like we've had over the last, many years. So, we are planning to do that with the current trends that we are seeing, and really would like to get input from you in the community, those folks who are on the front lines, and how you can, let us know what it is that you're seeing and that you think would be beneficial to have, topics about. Is it hoarding or any other ideas and suggestions? Hoarding is just one of them that we put out there because that's an issue that we see a lot of. But really look to you folks who are on the front lines on what it is that you're seeing and what could be beneficial. Because if you're seeing something that your elders are experiencing, and you work in the northern part of the state, that the same thing is going to be true for somebody in the southern part of the state. So really looking as to what those trends would be. If anyone wants to kind of throw in the chat, what are the current issues that you're observing around the state, and experiences that you are having working within the community, please feel free to throw that out there because we would like to hear from you as to what you're experiencing. Anyone would like to? You did have a one more thing on there, Denise. I'm so sorry that I messed this up.
Are you
Yep.
are you willing to take questions now, Michaela?
Yeah, so I see the chat, someone regarding gun safety and memory loss, in terms of rights, safety planning, and respecting rights while limiting access. I think that's a great question. I also think Denise, I don't know if you have any experience in that in terms of gun safety and older adults.
Generally in Narragansett, if there was an issue and a family member wanted the gun taken out of the house, we would take the gun to the police station and keep it in the evidence room with their name on it and things like that. So there are things that can be done. I think it depends on the condition of the senior or the elder, because again, they're an adult. So if they're competent, I don't know that there's much that the police department would do. But I think if there's an issue of competency and things like that, and the family's willing to step in, the police department would definitely help with that. And I can tell you that the advocate would definitely work with whoever made that call to try to come to a good solution to something like that.
That's exactly what I was going to say. Having that good communication and connection with the advocate, if a situation like this does come up, having that, connection is really important. So they can assist you on trying to, whether it's working with the family, working with the elder, to be able to make sure that there is, safety. Because obviously we understand that. One of the questions is, are police officers trained on elder abuse outside of the training that they receive at the Citizens Commission annual training? I will say I know there is limited training that's available at the academies. I know, and I think Jean Gategno will be speaking to her program later in the day, that she has in training police officers through her grant on being able to train specifically about elder abuse and how to really handle and investigate and work these cases. It is something also that my office is looking into and trying to develop some training for police officers and really kind of changing the conversation from when it comes to someone going out to a call versus a well-being check, and changing that they're not just going out for a well-being, that this could be something that's an investigation into abuse, right? So if we're changing that conversation, that they get a call and they want to check on the well-being of an individual when they go into the home, other things that they should look out for that may be indicators that this person is being abused, checking their fridge as an example, or is there broken medical equipment? Are they getting their medications? Certain things that they'll be able to look out for, knowing that this isn't just a well-being. Are they a harm to themselves or others, that they may be, reaching out to the police because they are in fact a victim, and kind of changing that conversation. I think that's something that we're doing here and really trying to educate not only, the police officers, but really the community too, and changing the conversation that elder abuse, is an issue. It's an issue here. It's a crime. That's why I think we want people to also be able to understand, it is a crime. We kind of always talk that, elder abuse is where we were years ago regarding domestic violence and how laws were able to be changed to help the victims of domestic violence. And now we're doing kind of having that same conversation and changing, the laws and changing people's attitudes and opinions regarding elder abuse. And Denise just put in the chat that link for everyone.
Yes, and I think the academy does cover some of the elder abuse so that everybody coming on the job has some information on elder abuse, but I think it needs to be reinforced over time.
Absolutely. I'm just going to stop for a second because I know that our next slide is I want to be able to get everyone our contact information. And I did send myself the correct presentation. So whoops, I don't know what the heck I'm doing here.
Kayla, I did get also comments sent to me. Elders facing homeless and mental health issues are the two that I received.
Okay. If you just give me 1 second, so that way I can try to get myself back in order here. Because I clicked on the wrong thing. Here it is. Yep. Okay, perfect. All right. Sorry, thank you for bearing with me here, everyone. All right, I did not want to play from start, so I'm just going to go back. Here is your slide. This does have Mary Ladd's information, as she also, OHA is a statutory member of the commission. So sorry, Mary. And we'll go back. So here, again, this is just where we were. If anyone else has anything, I think there's a couple. Sure, someone had mentioned that laws are changing. So can we expand on that? If you are going to be part of my and Molly Cody's presentation after the lunch break, I think if we're ahead of schedule, I think we're at 1:30, but we're going to talk about a new banking legislation that was passed. So I won't get into details because we're going to get into details in our presentation in a little bit. But that's one of the really important things that I think were done this year that came out of the Senate task force that studied elder abuse and financial exploitation. That was chaired by Senator Coyne. And we were able to put a banking statute into place that really will help for financial exploitation cases. So we'll get into that in a later presentation because we have a bunch of details about that. Denise, there's a question for you. Is it in your experience that police departments will do a well-being check on an elder when there are concerns for their health and safety?
Absolutely. Absolutely. We did it all the time. And that was kind of us doing the regular visitations. There were several times where we would run into, be doing a check, and an elder had fallen and actually was there for a while, but it just happened to be the day that we were checking. So we will definitely do that. And then they try to connect with the family and get the right services in there if there is a problem with either the health or safety.
Great. This is our contact information for both myself and Denise, as well as Chief Susi. So if anyone has any questions or has any ideas or comments or anything that you think that the commission would be able to do, and especially for our conference, like we said, we're hoping to plan something in the spring. So if someone is interested in being able to provide us with any ideas that they have for presentations, we'd really be happy to know. And someone asked when the next commission meeting is. We don't have a date set yet, if I'm correct.
No,
So I don't think
you're correct.
right now.
Yeah, and one other thing is we will be in the process of updating the list of both police and fire advocates. And so once that's done, we'll get that posted, hopefully maybe to the OHA website, or if not, then we'll try to get that out to you.
Absolutely. And I think, again, to get to the point of really making sure you know who your senior, police and fire advocates in your communities are. And I think we really mentioned, but the fire advocate's important too, because they may be going out to the homes and they're seeing the hoarding. They're seeing certain things in the home that their fire or EMS responds to versus the police. So having those connections and knowing that you're a resource to them as well, so that if they're going into a home and, the fire, rescue's been called there multiple times, they also know that you're a resource to them to be able to reach out to and know if that person's in need of services, having those partnerships are really important.
And I just want to add, don't be surprised if you call your police department and the dispatcher doesn't know who the senior advocate is. That often happens. I would recommend asking to speak to the chief and just getting that information, because he or she will know.
Yes, that's a great point.
I have to be honest.
Mary, you raised your hand. Did you want to mention something?
Yes, Denise, so when that list gets finalized, I realize it's kind of a fluid list, but when you have a final copy, we would like to post it on our website and so if you could send that forward to us, that would be really helpful.
Absolutely, happy to do it. I'm hoping to maybe get some Roger Williams students to help with that, but we're going to get on that.
Thanks, Denise.
You're welcome.
And I'm sorry, Michaela, I don't know if I missed this, but are the meetings public or open to the public?
That is a great question. I think they technically are, Denise, right?
Yeah, I think
Yeah.
we just learned that we're under the open meeting.
Right.
So I believe they would be. And quite honestly, we're looking for members too. So if you are interested in becoming a member, I would send a note to Rick. And I don't see, it's easy now because of Zoom. But when we meet in person, it's kind of a small room, so it may be more difficult at that point for the public to attend. But if there's that kind of interest, we'll make it happen.
Absolutely. Yeah. And certainly if anyone is interested, please reach out to us to be a part of the commission. Like we said, we're still changing the legislation and our membership is, I believe, it's at 21. I think it's technically supposed to be around there.
Yeah.
So certainly looking for members if anybody is interested in being a part of it.
Great, thank you so much.
All right, if anyone doesn't have any other questions or comments, I think I have the chat. I don't know if there's a Q&A too, Nicole, that I need to look at.
Nope, so I think you got all the questions. I don't see anything that you might have missed. Again, the only suggestion that was sent directly to me was elders facing homelessness and mental health issues.
Yes, sorry. Yeah, I think we know that housing is a huge issue across the state right now, not just generally with the elder population, but with the entire community. So I know that's something that's a conversation that's being had. I don't think I have the right answer for it. I think, again, being able to work and know who the community partners are and who that you can reach out to for assistance if you're working with a client and knowing that, there's an agency out there that can assist you. But we know that housing is a huge, and homelessness is a huge struggle, and especially with older adults. We know that there's not enough beds available. And even if a bed is available, is a homeless shelter the right thing for an older adult, whatever their needs may be and whatever their circumstances are. So it is a large issue. I know just from reading in the paper and from, some COVID relief monies, that's an issue that they're looking into. So I always kind of say this, but, reaching out to the legislature, and if you have, comments or anything that you can to provide from cases that you've worked, I think that's helpful for folks to know from the ground up, how things are, on that level.
And from a mental health perspective, I think BH Link is the place to go for assistance with mental health issues.
Absolutely. All right, I think that's from us. Right, unless Denise, are we missing anything?
I don't think so. Just please contact us if you have any ideas for training or how we can help you connect. We're more than willing to help.
Absolutely.
Thank you both so much.
Thank you.
Thank you.
Thank you, Denise. Thank you, Michaela. That was an excellent presentation, and I know I learned a lot. So I really appreciate you taking the time. And I think I might have mentioned earlier, we are way ahead of schedule, which is great news for everyone on this call. We'll break out into lunch early. The next session will be from Michaela and Molly Cody at 1:30. And they will be talking about the Elder Abuse Unit over at the Attorney General's office. So see everyone back here at 1:30, and then following that, we'll go into our breakout workshop sessions. So on the agenda, and you'll see that on your screen as well when we come back, we're going to have workshops, breakout workshop sessions, 4 of them. And you're going to be able to select on your end which ones you want to attend. They're roughly going to be 40 minutes each. So once we come back, we'll introduce that and help folks figure out which ones they want to go into. So yeah, see everyone back here at 1:30. Thank you so much.
Meeting's being recorded. And I am the prosecutor in the Elder Abuse Unit, and this is...
And I'm Michaela Driscoll. Hi, everyone again. Just saw you a little while ago. And if you didn't see me before, I am the investigator in the Elder Abuse Unit at the Attorney General's office. And I'm going to actually start sharing my screen. I have the right presentation this time. I messed up, Molly, the last time. So I got everything going.
Never do that. That's inexcusable.
I blame the office that they don't give me a monitor with a camera.
All right. So everybody can see Michaela's screen.
I think so.
Okay. So I'm going to get started and tell you a little bit about the Attorney General's office for anyone who doesn't know. I do see a lot of people on here that we work with on a regular basis, but I also see a lot of people that I don't know. So again, we're excited to kind of be here and tell you what we do. But the Attorney General's office is the chief law enforcement officer for the entire state. So we are involved in a lot of different things, both criminal and civil in nature. So we have 3 divisions, as you can see. The first is criminal. That's where Michaela and I work in the Elder Abuse Unit. The other is the civil division, which represents state agencies, being sued and gets involved in lawsuits on behalf of the public good, and they do a variety of other things. And finally, there's the BCI, the Bureau of Criminal Identification office, which is responsible for maintaining local Rhode Island criminal records, as well as fingerprinting people for jobs that involve children and things of that nature. They're also investigators in that unit. So our office is responsible for the prosecution of all felony matters in Rhode Island. Rhode Island's so small that we kind of take on the role of the district attorney and what in other states or county attorney, but we're able to do that all out of our office and our county offices because of the size of our state, which is wonderful. We handle all felony criminal matters, and we also handle misdemeanor appeals when somebody appeals their case from the district court, as well as the prosecution of misdemeanors for all state law enforcement agencies, including the state police. So next slide, please. The Elder Abuse Unit, which is at this point essentially Michaela and I, and really Michaela does a lot of the heavy lifting, but basically the unit was established in 2005 by the legislature to recognize that our older population was on the rise then, and it continues to grow. And unfortunately, as many of you know, our older population is targeted for a variety of different types of crimes. I'm not sure how much you've gotten into that today, so I'm not going to repeat anything anyone else may have said. But our unit is established to protect the public safety, health, and welfare of our older population. Our primary responsibilities are to investigate investigative management, investigate crimes, follow up on referrals made directly to our office and from the Office of Healthy Aging, and prosecute crimes involving elder victims of abuse. But as many of you know, the people we've worked with and some of the community partners we have that are on this presentation today, our responsibility goes far beyond kind of what the original statutory intention, well, not the intention, but what was initially established. We do a lot of community outreach and preventative education with our older population, because that is the only way to truly make sure that people are safe and aware of scams and the way that different people target them. Because basically, by the time a case gets to us, if money has been stolen, it's gone. And we can get a conviction, but if the judge orders restitution, for example, say $100,000 was lost. If that's paid back at a rate of $20 a month, that does no good for an older person who needs that money to live. It also causes all sorts of other consequences for Medicaid and other benefits that people may or may not be entitled to if all of a sudden one day they had a ton of money and the next day it's gone. So we do a lot of preventative work, getting out in the community, working with individual victims and trying to make sure that people are safe. We also do a little bit of triage work. So, if something comes into us and we can't prosecute it, we're not just going to simply turn our backs on someone. So we try to make sure that they get to the right resource for the type of support that they may need. And there's a very exciting new tool that I'm going to talk about closer to the end of our presentation involving financial institutions. And at this point, I'm going to turn it over to Michaela for the interesting information about scams and frauds and all the different ways that people target older Rhode Islanders.
Sure, thank you. And one just thing I'd like to add in terms of prosecution of cases, as Molly said, we prosecute all felony level cases. So you may be working with a client and the perpetrator was charged, as just an example, a simple assault versus an assault on a person over 60. The simple assault is a misdemeanor offense, and those offenses are prosecuted by the city and towns, versus an assault on a person over 60 is a felony charge, and that's something that would be prosecuted by our office. So just as a little distinction, if you do come across cases that are misdemeanors, that is not something that is handled or prosecuted by our office.
And I would just add to that, I don't have any data on this, but the cities and towns don't have dedicated units for elder abuse as far as their prosecution offices go. As many of you may know, the cities and towns hire private attorneys to do their prosecutions on different days of the week, whatever day they are scheduled to be in court. And, we have a very serious attitude about the cases we handle and try to do our best, but there are a lot of obstacles in achieving a successful prosecution. Obviously, if someone has a capacity issue and can't testify and there isn't another way to prove the crime, that's a problem for us. Or oftentimes older victims don't want to move forward because they don't want to get a family member in trouble, or they don't want to get their caretaker in trouble, and they're scared that they could be subject to further abuse or just not have anyone to care for them if they move forward against someone. So the cities and towns, though, are dealing with different crimes. So the person may be over 60, which in our minds makes it more serious, but they're dealing with the misdemeanor charge before them, and their obligation is a little bit different than ours. So the results, I think, are a bit different as well. As Michaela pointed out, there is a distinction there. And I don't know if anyone talked about it before, and I apologize if anybody did. But one of the things that's very common to elder abuse is polyvictimization. Michaela, I hope I'm not stealing something from one of your slides.
No.
But it's very important for everybody who works with our older population to understand that elder abuse is very different than any other crime, because oftentimes if one type of crime is going on, one or two other, or more than that, crimes are probably happening as well. So for example, if a grown child is being given money by their older parent and the parent decides to stop, that may lead to the grown child, becoming angry and physically abusing their parent. So one crime kind of begets another with elder abuse. If someone is financially exploited, they're out of money, and they may end up being neglected because they can't pay for care from a professional agency, which sadly, our crimes come in from all different places, and sometimes it's a professional caretaker sent by an agency who ends up exploiting or abusing an elder adult.
All right, so I'm going to get into a little bit about fraud and scams. And we're going to talk a little bit about, different common scams, that we see. And I'm sure many of you have received a telephone call that the warranty on your car has expired. A lot of the common scams now that we're seeing, and we certainly have seen an increase in the amount of scams that are coming through, and they come in waves, right? So we'll see, as an example, a lot of times, especially now this time of year that the weather is getting colder, we'll receive an increase in the amount of people who are getting a call, which they think is National Grid, that they're behind on their bill and they have to pay right now in order. If they don't, their heat's going to get shut off. And especially obviously now with the weather changing, the scam artists know that. So we'll use that call to get people to, fall victim to it. We see a lot of the different lottery and sweepstakes scams. I think it was actually just in the paper yesterday or the day before of some arrests that the U.S. Attorney's Office had made from, one of these types of scams that had been going on. And a lot that we also see are these imposter scams. Like I said, the National Grid, someone calling that they believe is from Medicare. We are contacting you because there's an issue with your, Medicare, or we want to now change. We know it's open enrollment season. We want to change your policy. Just give us your number or your social security number, giving that information. So these imposters who are being essentially these other different types of agencies. We know for sure that the federal government, especially Medicare, the IRS, they're not going to call individuals just out of the blue. I mean, if you try calling yourself, you're almost on hold all day with the IRS. They're not going to contact you. And especially when they say that you owe them taxes and the way that you can pay them is in Apple gift cards. It doesn't make sense, right, to kind of us think, obviously the government is not going to be asked to pay in Apple gift cards. But what happens is these scam artists put this fear in people, and they make them believe that if they don't act now or don't respond, something bad is going to happen to them or to a family member. So that fear that gets put in makes them, make these rash decisions and not act, accordingly.
If I can interrupt
Sure.
for 2 seconds, as I'm famous to do. All of these scams are based on some strong emotion, whether it's fear or love or something like that. And like Michaela said, it causes people to act in very quickly and not take the time to slow down and think about what's happening and make a correct decision. But I did want to point out here with imposter scams, what is so disturbing about them is, for example, if you're, purportedly your bank or your credit card is calling to say that there's been suspicious activity on your account, can you just confirm your account number or your social security number or something to that effect? It gives this false sense of security to people that, oh yeah, this is my bank. They already know. They just need me to confirm the information. And so those are the most dangerous because they're on to us and the work we're trying to do to prevent people from falling victim to these scams, not just us, but elder abuse prosecutors and workers across the country. So I find this to be the most disturbing scam because you feel like they already have the information and they're trying to protect you. So we really try to highlight that for people and tell them to not give out information and call their bank or credit card directly if they really have a question.
And a lot, and we see unfortunately a lot of that just in the last couple of days on referrals that I received. One was, this was Amazon calling, did you just purchase a Apple iPhone? That's what they're contacting them. Or, an email, what they think is from Bank of America, who they bank with, saying there's a problem on their account, just click on this link. And that's something we always tell folks is like, never click on links in your email, never give out any of your personal information over the phone. Certainly if you receive any of those types of calls and you think maybe this is my bank calling me, because, financial institutions do that. They will contact customers if there's suspicious activity on their account, but it's always something you want to make sure that you hang up, call the number that is for your bank or credit card company. The grandparent scam is one that's been around for kind of, as long as I've been here, which is going on 16 years, where people receive a telephone call that their grandchild has either been arrested and needs money for bail, or was on vacation, became sick, and they need money to get home. And again, that's on that fear, the emotion, the love that people get that call and think, I have to act now. I need to, go and wire money because my grandson needed money to bail himself out of jail. So it's really, it's kind of a scary one. And I was speaking to a woman last week at a presentation, and she said, I got that call and she thought, for a second, I need to help, but then realized when she kind of took a step back, they said, hi, grandma. And she's called Nana. So she thought, she's like, okay, they know it's, it's not really my grandchild, but she told me, she said, for a second, I thought to myself, oh no, like I need to help. What is it that I'm going to do? And that's what we always try to tell people is, take a step back and think about it. Call your grandchild, call your, your children. Do you know where they are? Asking those questions, because the scam artists always tell people, never tell anyone, don't say anything. And they coach them to really, when they need them to do something, for example, they're saying, you just won the lottery. We need you to pay money for your taxes and fees and whatnot before we give you your winnings. Go to the bank and wire $10,000. But they know you've never wired $10,000 before. So they're going to ask you all of these questions. And what you're going to tell them is you're wiring this money because you have a relative that needs help. And that's why you're sending money to them. Or, you're withdrawing $10,000 today because you're going to be updating your kitchen. So these scam artists will coach victims on what to say and what to do, because they know when folks go to the bank, the teller is going to ask certain questions to them, asking why they're doing that transaction. Or when they go to CVS to buy gift cards, I even notice now, because I bought a gift card legitimately a couple of weeks ago, there was a screen that popped up right on the the credit card reader asking a couple questions. Are you sending this card because you received a call or an email or asked to do so? So, banks, financial institutions, retailers are really trying to help stop this, but the scam artists sometimes seem to always be, one step ahead of us in trying to, knowing we're educating people and doing the things to try to get people to believe them. Again, we have seen a lot in increase, I would say, and I have a slide on it, and the amount of romance scams, especially now, I think because of COVID, where people are home, they are much more isolated, not having contact with friends and family members, and then turn to, and believe it or not, a lot of older folks dating websites that they'll go on, but not even necessarily just going on a dating website. It's starting to use social media, going on Facebook, Instagram, or different games and apps that you can download on your phone. An example of that is Words with Friends, where we had a woman fell victim when she met someone playing Words with Friends and thought that this individual was her boyfriend, and ended up sending, unfortunately, millions of dollars to this individual. So these scam artists, they kind of, hang out, if you will, really anywhere, and especially with social media. And now, especially because, it's not necessarily just the phone, and with older adults being home and people are using the computer more, using tablets, and there's a lot of great programs out there that are trying to get technology into the hands of older adults. But we need to kind of also take a step back and realize now that they have this technology, making sure we know how to use it properly to not fall victim to these types of scams.
And if I could just add there really quickly, there is kind of, I hate to say, like a victim profile that we've come across, which is particularly sad because there isn't a lot we can do about it. Obviously, working with older adults is different than working with children because older adults have autonomy and can make their own decisions. But there are victims who know that they are part of a scam or are victim of a scam and don't care. They'd rather be engaged and involved in talking and being part of something as opposed to just being completely isolated and alone. So again, they have the right to do that if they're of sound mind. And that's very frustrating for us because we want to protect that person, but we also want to protect other members of the community from that type of perpetrator.
And sadly, we see a lot of, victims who don't want to believe that they're a victim of a scam. As just an example, I worked with a woman, now we're going on 3 years, yes, 3 years, where she was a victim of a romance scam. And I met with her along with the police department. We talked to her because we knew she was sending money to this person she met on a dating website. And she said, yeah, I don't think you're right. Even just a police officer, myself coming to talk to her. She said, yeah, okay, but you know what? I'm all set. I'm not being scammed. 2 years later, we go back. She had pretty much wiped out her entire savings account. We're talking hundreds of thousands of dollars. And myself and more law enforcement representatives went out to try to talk to her as well as her family. She still didn't want to believe it, that she fell victim. She loved this man who was overseas. And I said to her, she met him on a dating website and he told her he had millions of dollars. He was working overseas and, couldn't get here to the United States, but when he could, they would meet and, live happily ever after. But, of course, he was going to come here. They finally were going to be able to meet. He was on his way to the airport and got into an accident and killed somebody. And then he was in jail. And then he needed money, for bail because he needed to be bailed out for, the crimes that he was being charged with. And still to this day, she's still talking to these scam artists after her family, law enforcement, everyone has been involved. And unfortunately, sadly, she's, like I said, lost almost her entire life savings because she, met this individual who brainwashed, for a lack of a better term, her to believe that they were, in love. So unfortunately, that just happens far too often that we see. Here's just a little bit of a slide. The Federal Trade Commission has a Consumer Centennial Network, which is a great resource. If you ever go onto their website, it has a lot of different data, and I pulled a few different pieces of information here, but just shows the amount of reports that were filed with the Federal Trade Commission. And I think it's important to know, and as we all know, that elder abuse is vastly underreported as a whole, but especially with scams. People do not want to report that they were a victim of a scam. They're embarrassed. They don't want to admit that they, fell for something. A lot of people will always say, like, I was so stupid. I can't believe that I did that. So this just really shows in terms of reports, again, that were made to the Federal Trade Commission. There were 4.7 million reports. This is the 2020 data. The number one would be identity theft, which I'm sure, again, that has happened to many of you, myself included, have fallen victim to identity theft. And, in terms of the amount of loss that people receive. And what they have found is that younger people reported losing money more often than older adults, but older adults lose a higher amount of money to these different scams that they may fall victim to. And this just kind of breaks it down of these different types of scams. And as you can see, the number one, the imposter scams, and the amount of reports that the Federal Trade Commission received. But I will note, when you kind of look down at it, the highest dollar or the median loss for these types of scams were business and job opportunities. And I think, that goes to show, especially because of COVID, people losing their jobs or being home and trying to see these different, offers, I guess, if you will, that are made online, mystery shopper scams. That happens all the time. Just go to Walmart and check, give us a report on their customer service and we'll send you a check, for the services that you did. And the check comes back fraudulent. So the business and opportunities, you can see that there was a 1950 was the median loss for people there, as well as the foreign money offers and fake checks. Again, similar in nature as that what happens with the job opportunities, you will receive a fraudulent check onto the account. And what a lot of people don't realize is they may get these types of fraudulent checks. They look very, very legitimate. You probably almost couldn't tell the difference between a real check and a fake check. But what happens is they'll go to the bank, they deposit the check into their account. Well, the check goes in, the funds are available, but because they're available does not mean it's cleared through the bank. And a lot of times folks will either start spending it, or they'll send you a check and say, we sent you a check, but we made a mistake. We sent you one for $10,000 when we really meant $1,000. So if you just deposit that and then wire that $9,000 back to us, you can keep the $1,000 and we'll call it a day. So people will see that the funds are available, withdraw the money, but the check actually hasn't cleared through the bank. Usually, sometimes it can take up to 7 days to fully clear. And then the check comes back fraudulent. You've withdrawn that money, and then the bank is going to come after you now for whatever the money is that you withdrew from the account. So unfortunately, that's how those scams work. And unfortunately, sadly, all far too often. And this is just the Rhode Island. I broke it down into the Rhode Island data. So of the 5,400 fraud reports that were filed, and again, just remember, this is what was filed with the Federal Trade Commission. So we know it's significantly higher that people fell victim to some type of fraud or scam. And I just thought it was interesting because, what's reported is $4.2 million was the loss here just in Rhode Island. Again, you'll see identity theft is the highest category for different of their reports, but imposter scams is second there with 1,300, little over 1,300 reports that were made, again, of what we know of reports that were being made to the Federal Trade Commission. And this slide just shows a breakdown of age. And I just thought it was interesting when you look at the age difference, so someone between the ages of 30 and 39, they say here, fraud affects every generation differently. And it does, because when you look at it, those folks, and they're similar in how they're being contacted. It's the online shopping, the imposters, the tech support is higher for older adults. And that's one we see a lot. This is Microsoft. There's a problem with your computer. You and Molly can tell you a quick story if we have time about that, but it happened to her dad. There's an issue. You need to send us the gift cards. Happens a lot with older adults. So you can see how the payment methods, which I think is interesting, that credit cards are still how folks will pay generally between the ages, the ages of the 30 to 39 and the 70 to 79. And the gift cards, again, with older adults is something that's higher, as that's how they're paying and getting folks to pay with the gift cards. But I think what's interesting is the contact method. For the younger folks, it's the website and different apps. For older adults, it's still the phone call. And I think that's something we try to tell people. I had a woman call me yesterday. She's been getting calls for years that drive her nuts, for whether, like I said before, the warranty on her car, she's literally got every type of call. And it's very difficult, but we always try to tell folks the best thing you can do is, unfortunately, just not answer your phone if you don't know who's contacting you. And we understand, especially with older adults, they're answer the phone. Again, a few things. You're lonely. They want to answer the phone. They want to talk to somebody and will listen because they're nice. They're not like the younger generations who will just hang up and not talk to you, or, don't talk on the phone at all. But older adults will answer the phone, they're home, and that's how they're being contacted by these scam artists. And the amount of loss that the median loss is higher compared to younger populations.
I could jump in for 1 second.
Sure, I'll go back.
one of the pieces of information or advice that we give to older adults, if they can handle it, is to just not answer the phone at all. And, have them tell their family members or doctor's offices that they're doing that and to leave a message, and that they'll call back. But again, this is how some people are used to communicating. So it's really hard to convince this part of the community not to answer the phone, especially when there are so-called spoofed numbers where a number looks like your bank or a family member, or a number that you recognize. So we do tell people, if they can handle it, to not answer the phone at all.
And then this next year's slide, and I'll tell a quick story about a case that we worked on, but romance scams and how much it has increased over the last 4 years of, again, just reports. And I think especially with romance scams, people are very embarrassed and do not want to admit that they've fallen victim. But again, it's that emotion that's there and that love. And they really think that they've found, their future husband, who just so ironically happens to be a millionaire. But just the dollar amounts that have been lost. So in 2020, $304 million were lost to romance scams alone, which I just think is, a staggering amount of money that people have lost. And what we know is being reported, we know it's much higher. But $304 million is just, it's just a crazy amount of money. And I'll quickly just tell a quick story that we worked on, and Molly had said kind of what the victim profile is. And this goes back a couple of years, where we were contacted from regarding a woman who had fallen victim to a romance scam. And what she was doing, she was playing words with friends. And she was almost the perfect victim. And I think a lot of you folks may, deal with this particular type of client, where she was recently widowed. She did not have any children. She lived in a relatively rural community here in Rhode Island. She had recently had a surgery and was homebound, and was, when I say addicted, she was absolutely addicted to playing words with friends. And so she was on there, probably the most better part of her day playing, and she would start chatting with these different people. And she started chatting with this one person who their conversation started very innocently, regarding the game, good game, whatever, how you chat on that. And then it turned into a friendship and into more of a romantic relationship. And he told her he was a general in the Army, which is always a huge red flag. And people, the scam artists will use that, and they use actual real names of generals in the Army, because you can go on Google, right? Anybody can go and we'll do a quick Google search and find that there's somebody really by that name. So it's so it legitimizes it a little bit to these victims. And he told her that he had all this money and jewels that he needed to help get to the United States. And by doing that, he just needed her to accept these boxes, if you will, at different airports throughout the country. But she would need to pay taxes and fees and customs and things. He really had a reason for everything, that why he needed the money. And he had a response to every one of her questions. So she was sending him money. But it's not like she met this person and said, hi, I'm, General Smith. I have millions of dollars. I need you to send me $10,000 today. These scam artists groom victims over periods of time. So this particular case, it was 9 months before she ever told anyone. And over that period of time, she started sending money. And she was sending money any which way possible. You name it, cash, check, wire. At one point, she stuffed $50,000 in a teddy bear and sent it to an address. Every which way she sent it. And when I say that she was sending all of this money too, she didn't have, all this money in a bank account stuffed in her mattress. She, sold homes. She took out cash advances on credit cards. She cashed in different annuities and whatnot. So she basically liquidated all of her assets while falling victim to this scam. And over that 9-month period, she actually sent $1.4 million to these scam artists. And we were able to get federal law enforcement involved. It was the postal inspector's office, because she was sending the money through the mail. And through their investigation, which started here in Rhode Island, they actually found 25 victims throughout the country who had fallen victim to this particular ring. And they were able successfully to actually arrest 2 individuals in Texas and bring them back here to Rhode Island, which were 2 young girls, were essentially kind of mules to this scam, if you will. Most of the money was then being sent overseas, which we do see a lot of in different scams. That's a success. And that's something, as I kind of to my next slide, as kind of key takeaways a little bit to my presentation, is about reporting it. Because if you don't, even though it's a scam and it doesn't seem like anything can happen, it can. We have a lot of great partnerships with our federal law enforcement agencies, with our local law enforcement departments, and a lot of the big federal cases that come out start at the local level. So I think it's really important to make sure that you're still reporting this information because, especially as Molly will get into in a minute, with the new banking legislation that was recently passed for financial exploitation, there's a lot of great new tools that we're able to use with the financial institutions to help try to protect individuals who are victims of financial exploitation. And that can include scams. It doesn't necessarily have to be that it's a family member that's stealing from them. If the financial institution is able to determine that this person is being scammed, we're able to use our tools as part of the new banking legislation that's available. So it's still really important to make sure that you report this information to, OHA, to any local law enforcement. You can reach out to us directly if you're working with a client who is a victim of a scam, that we can try to, assist and see what in terms of what we're able to do investigating the cases. Am I going to say that we're going to catch every one of these bad guys and, try to stop these scam artists? Unfortunately not. That scam artists are usually one step ahead of law enforcement, but it's also important for us to be able to know what different types of scams are out there. So when we go and do our presentations, which we, did many, obviously COVID, unfortunately put a little bit of a halt to it, but try to educate folks as much as we can about these different types of scams, because we found that that's really the best way to try to help prevent them from happening. So it's really important to report it. A few different resources from our website, the Federal Trade Commission, the Internet Crime Complaint Center is a great resource, and also where you can report the different types of scams on there, as well as the Cybercrime Support Network. Certainly some great resources that are out there. And like I said, if you ever have questions, you're working with a client who may be falling victim to a scam, please reach out to us so we can try to, assist if we can.
Okay, I will pick it up from here. Excuse me, I have a little bit of a cough today, not COVID. But one thing I want to add that's so important about reporting and about the presentations that we do and the work that you all do is that we're really trying to change the narrative and change the atmosphere so that older folks know that they're not alone, that there are a lot of people falling victims to scams and abuse, and they can seek support in one another, and they can know that they don't have to be embarrassed, that this is happening to a lot of people, and that there are resources available to help them. And even if it's not for their own personal good, like I said before, there's a civic duty that we hope to impart to older folks, which is it may be happening to you, but it could also be happening to many other people. And of course our interest is in helping individual victims as well as the community as a whole. So we're really trying to create an atmosphere where people are not embarrassed, not afraid, and know that if they come forward, they're going to get help. So I'm going to talk now about the new financial legislation that has been passed. It was, I believe, passed in June of this year. And we were involved in that. But, we noticed that, as Michaela's been talking about, and I spoke about earlier, we can try to prosecute and get restitution, but the money is gone. So one of the things that we try so hard to do is, if we're brought into a case early enough, is stop the bleeding. and, at least temporarily make sure that this is what this person wants to do, that they're not the victim of abuse. But we had a really hard time for a long time convincing people that they were the victim of scams, and just, before they knew it, their money was gone, and they're coming back to us saying, what can you do now? And it's, not much. So this was something we were really happy with. It came out of the Senate Task Force on Elder Financial Exploitation and Abuse, and it addresses the what I just said, that when there are suspicious transactions or banking activity changes by a regular older banking customer, this gives banks and law enforcement the ability to do something about that before the situation gets out of control. And basically, the statute allows banks, after they make a report to the Office of Healthy Aging, including all of the information that is required, that a bank can, if they decide it's appropriate, place a freeze on a transaction, a hold on a transaction, or a freeze on an account. If they think, someone's come in with a new family member, or someone is, making one of those big transactions that they've never made before, or someone is doing a lot more ATM visits or online banking that they've never done in the past. If some of the local banks are able to notice that because they are working with individual customers that they've worked with for years. So in addition to the questions that are being asked by tellers, which was great, but kind of overcome by the coaching that these victims would get, now there's actually this tool where these transactions and suspicious behavior can be stopped for a temporary period of time until law enforcement and the Office of Healthy Aging can get involved and figure out what's going on. And part of the statute requires that financial institutions receive training in how to use the statute and what they should be doing internally. We recently gave a very large training through the Rhode Island Bankers Association. And so they have an idea of what to do and how to use the statute. Next slide. So basically the obligations of the financial institution are before you. They have to suspect that some sort of financial exploitation is going on, submit their report to the Office of Healthy Aging, identifying the name, address, contact information, if known, of the older adult. They need to include in that report the name, address of any person responsible for the care of that older adult. Also, any facts, the nature and extent of the situation that's going on and the suspected financial exploitation, that all needs to be in the report to the Office of Healthy Aging, and any other information that's relevant needs to go over to OHA from the financial institution. Once they've made that report, then the bank can go ahead, if they feel it's fit, and place a hold or a freeze on a transaction or an account. They don't need to get anything back from OHA, but certainly they do need to report it so that the Office of Healthy Aging can help and get involved. So after the report has been submitted, the financial institution may report to a third party reasonably associated with the older adult. And this is where things really get tricky. And we invite banks, and we invite the Office of Healthy Aging, and we invite local police departments to contact us when they are doing this, because oftentimes we are aware of that victim and have, maybe tried to work with them in the past, or have some connection and information about the family. Because the hardest part for banks in this section of notification to third parties is trying to figure out who the good actor is versus bad. Because sometimes, like I said, it's a family member, it's a caretaker, it could even be a lawyer or someone taking advantage of the individual. So, we encourage people to reach out to us if you need help figuring out if and who should be contacted, and how to sort through the family dynamic. But listed here are some of the people who may be relevant: immediate family, extended family beneficiaries on someone's account, a professional like an attorney or an accountant, or anybody else who has the legal authority to transact on that person's account. But again, some of these people are the perpetrators that are actually committing the crime. So it's kind of difficult waters to wade through to figure out, what's going on and to not tip off somebody who may be the actual criminal. So next slide. So after a report is made to the Office of Healthy Aging, like I said, the bank may place a hold on any transaction or a freeze on a suspicious, a freeze on an account where suspicious activity is taking place. There are very strict time periods within the statute, and for good reason. We don't want to take people's money. We don't want to hold it from older people. And the statute addresses, and banks are addressing, how to make sure that people's bills are continued to be paid during a time where their account might be frozen or something like that. But the hold will expire 15 business days after the report is made to the Office of Healthy Aging. That time period can be extended to 30 days at the request of state or federal law enforcement. But it's so important that anybody who's involved in this type of situation bring us into the conversation very quickly, because we can do the work that needs to be done to figure out what is going on. Like I said, we may already know about the victim involved, but these are very short time periods to figure out what's happening with someone. And in that regard, the statute also allows this very powerful tool of being able to obtain an individual's bank records without first getting a subpoena from the court. So it allows the Office of Healthy Aging to get those records, it allows us to get those records, and it allows law enforcement, local police agencies, state police to get, and federal federal agencies to get records from the financial institution that would show them what's going on. And you can see it, we can make a request for 60 days prior to and 60 days post any suspicious activity. Now, one thing we would say here is that if the Office of Healthy Aging does get the records, that again, we work together so that we may know about that person, we may be able to read those records very quickly and figure out what's going on, because we all kind of have to work together to make sure that the bad actor isn't being contacted, and that, whether these activities are suspicious or not. Sometimes they're not. Sometimes people are legitimately using their money and have the right to do that, and we want to get their money back to them as soon as possible. Next slide.
And that's it.
So that's kind of the end, but the significance of the financial statute is that everybody watching today can play a role in using it to some extent. So, you report to the Office of Healthy Aging, they can reach out to us and let us know what's going on, and we can make that request for a hold or a freeze. Same thing, report to local law enforcement. They can make the same request. And if law enforcement makes that request to a financial institution to hold or freeze based on suspicious activity, the financial institution has to do it. If the financial institution is the one making the decision to hold or freeze, they may do it after they make a report to the Office of Healthy Aging. So it's very important that we're all working together, sharing information that we have, because there are so many great organizations working with our older community. And, if you have questions about anything, reach out to us. But especially if you find yourself involved in a financial exploitation situation where the statute is being used, please reach out to us, because like I said, the most important thing is we may already have information that could be helpful.
And one of the things too is, this is obviously very new. We just had our first training about 2 weeks ago now to many of the financial institutions through the Rhode Island Bankers Association. So the banks are still figuring out themselves on how they are going to kind of roll this out, if you will, and their internal policies. So we're working very closely with them, on doing this. I will say I'm aware of a few holds and freezes that have already been placed on accounts in certain situations. So as Molly said, it's something that, again, is very time sensitive because, for the bank, if they submit a report, the clock's ticking once that report is submitted, and they may not place the hold until 5 days later. But now they only have 10 days because the report was submitted, 5 days prior of those 15 business days. So that's why a lot of this is very, very time sensitive. And we're working very closely with the banks and trying to, work in terms of what their policies are going to be, how we'll interact with them. And then again, all these cases, will obviously be, once we review them, all reported to law enforcement. But, one of the things that we still have to go on, and I'm sure that and many of you find this, is that, if the victim doesn't want to go forward, we're doing all of this and then the victim still says, I'm not going to press charges. We know, as Molly said, as adults, we have our autonomy and they may make that decision, but it's really kind of working with the banks, working with the older adults, and then figuring out how can we stop, whatever is happening. Is it something that we can remove a power of attorney, from them because that person was their power of attorney, or removing someone from a bank account because it was a joint bank account? It's those kind of out of the box situations that we're going to work on to try to really help stop a lot of this financial exploitation.
So I think we've reached our entire time. We were hoping to leave some time for questions and answers, but I think we're out of time.
Anyone has anything, I think if they want to just throw it in the chat, or this is obviously our contact information. So please feel free to reach out to us if you do have any questions.
Any question about anything. Chances are we already know about the situation. So that's usually the biggest benefit to all of you. But we're here to provide guidance, both legal, although not official legal advice, but guidance and information to anyone who is in a situation and needs a solution.
So thank you very much again for having us today.
Yep, thank you. It's been a pleasure to be here with all of you.
Thank you. Michaela and Molly, thank you so much for taking the time to be here today. I'm really glad that you both agreed on doing this presentation. I always learn so much, even having worked at the Attorney General's office in the past. So I really appreciate, the helpful information, and I hope that everyone was able to take a lot away from your information as well.
Thank you.
Thanks.
All right, so if there are no questions, we're going to take a 10-minute break and then come back, talk about the breakout sessions. And then, like I said, I'll explain that when we come back, and we'll open it up to the group to participate in those. So see everyone back here in about 10 minutes. Hi, everyone. Welcome back. I am going to quickly explain the breakout sessions. So you're going to see them pop up on your screen pretty shortly. I just wanted to make sure I was muted this time. The breakout sessions that we have today are identifying and addressing hoarding, elder abuse in later life, the LTC State Ombudsman Program, and serious reportable incidents by DDH as well. So you're going to see them pop up on your screen pretty shortly, and then you're able to select which breakout session that you're going to go to. So as indicated on the slide, you can pick up to 2 sessions that you want to attend. So they're going to be roughly about 40 minutes. So this time around, pick the one that you want. The second time around, you'll get kicked back into this group here, and then you can pick the second session. And again, it'll be all same sessions going on twice. So you have the opportunity to pick and choose which ones you want to attend. So I'm going to open the breakout rooms for folks. Again, you should see it pop up on your screen, and then you just select which ones you want to go to. If you need assistance, I'm going to stay in the lobby and I'll help you navigate or drop you into the breakout session that you want to go to. So I'm going to open it up for everyone now, and you should see it pop up on your screens. It'll say all participants have been invited to join a breakout room, and you can go ahead and select which one you want to go to. So I think breakout rooms are now closed. Everyone should be back in this group session here. So this is the end of our APS, RI-APS conference. So thank you all for taking the time out of your busy weeks to spend the day with us. I hope that you took away a lot, learned a lot of new things. And as mentioned, following this, you should be receiving an email from me with documents that include resources from our presenters, also their presentations, and a quick survey. So you can expect to get that probably tomorrow. Being honest, while I gather all of the resources, I know a few folks had difficulties with working in the office and were working from home. So I'm waiting for just a few more resources to come through, and you should get that by end of the day tomorrow. So I will let Mary take it away and say our goodbyes and thank yous.
Thanks, Nicole. So I just wanted to thank everyone, all our attendees and our presenters and our partners, both our community, our Rhode Island community partners. And I know we've had folks on today from the Administration for Community Living, including our keynote speaker. This conference has been 3 years in the making. Nicole Arias has really, she pushed it off the ground. I want to thank her for everything she did and does. And she already came in my office today and wants to start planning the next one. So stay tuned on that. Once again, just thank you to everybody. I want to thank our internal APS staff. I feel like I'm kind of at the Academy Awards now, and maybe the hook will come out and kind of like drag me off. But seriously, folks, thanks for attending. I learned a lot today. I learned a lot of things I didn't know, and I hope you did as well. So have a wonderful evening. Thank you.